Welcome, council.
Okay.
Good evening. Happy December 8th. Welcome. We will begin today's Social Services Committee, and I'll ask Jessica to call the roll.
Thank you. Councilmember Burns.
Here.
Councilmember Reed.
Here.
Great. Ms. Kathy Hayes.
Here.
Chair Olds-Fry.
Here.
Great. And our newest member, Mr. Ken Rowling.
Here. Thank you.
Wonderful. We have a quorum, so we will begin. I need a motion to suspend the rules and hold this meeting virtually. Do I have a motion?
Yes.
All right. And do I have a
Second.
thank you. And with that, Jessica, can you call the roll, please?
Sure. Chair Olds-Fry.
Yes.
Thank you. Councilmember Burns.
Yes.
Thank you. Councilmember Reed.
Aye.
Thank you. Ken Rowling
Yes.
and Kathy Hayes.
Yes.
Excellent. Thank you.
All right, wonderful. And our next item on the agenda is an approval of the minutes from November 10th. I would need a motion to approve the minutes.
I so move.
Thank you, Kathy, and I would need a second.
Second.
Thank you. And with that, Jessica, can you call the roll, please?
Thank you. Chair Olds-Fry.
Aye.
Councilmember Burns.
Aye.
Councilmember Reed.
Aye.
Kathy Hayes.
Aye.
Great. Ken Rowling.
Aye.
Thank you.
All right, wonderful. Well, we are moving right along, and we are going to open it up to public comment as our next item. I do want to note, as has been the case, I think for quite some time, we actually have 2 time periods during each of our committee meetings for public comment. So we will start with the Mental Health Task Force that has submitted a letter that all the council or all the committee members have in their packet. And then we have an additional public comment period at the end. We've had public comment 2 times at every meeting for the past at least 10 months. And with that, Jessica, and one more reminder, if Jessica promotes you, you are allowed to speak. And if she accidentally boots you, just join back in. It's not purposeful.
Thank you. So of the attendees, I recognize several mental health task force members, but there might be members I miss. If you could, as an attendee, raise your hand, and then I will get it so that you can talk. Okay, perfect. Cindy Castro is coming on first. Thank you.
Can you guys hear me? Oh, there we go. I was like, I can't see myself. Well, I really can't see myself, but you guys can hear me, right?
Yes.
Yes.
Okay, perfect. And Jessica, just FYI, it'll be myself and Allie speaking on this part of it. So it won't be the rest of the members. You probably see other members on there, but they're just here to support.
Okay, well, but it's public comment. So anyone who
Yeah,
raises their hand who
sure.
wants to, I will, but yes, Cindy and Allie. Okay, perfect.
Perfect. Well, thank you, everybody. So yeah, my name is Cindy Castro. I'm the manager of the Outpatient Behavioral Health Clinic at Ascension St. Francis. And I'm also the co-chair of the Mental Health Task Force of Evanston. So just thank you for your time, your dedication, and the intent to focus on funding for needed and crucial services. We know that having us here today added probably a little bit more work, but we truly appreciate having this opportunity. It really felt good to be heard, and for you guys to take this step. So I hope that you guys all got the chance to read the document that we submitted. It does outline several, like an overall of this work that we have done as a task force for almost 3 years at this point. But of course, it doesn't go into detail with anything. We have a lot that we've done, and it's hard to really detail everything out. But right now, we're really just a group of volunteers within our agencies bringing together our expertise and passion to provide what we can for the community. So just kind of to outline why we're here, right? So we did, I do want to emphasize that we have met with Jessica about just kind of the process. We did it early on to give her some of our information, specifically like the Axes and Gaps document that we have developed in these 3 years. and also just, background information on what we can provide, what we think the needs are, what we think the gaps are, and kind of moving forward for us. And you guys did extend this original application. So that was much appreciated, because originally it was probably giving us like a month or so to apply. So we do appreciate that part of it being extended. We did try to get the agenda on your agenda, probably around May or so, but I know you guys are so busy. So that's why we didn't get a chance to do it. And then also originally we were going to be in this meeting to share the concerns that happened about the November 10th meeting, but everything moved so quickly. So that's why we went to council. So we definitely don't want it to seem like we didn't want to come here first. It's just because of the process, right? With how it moves along to city council. So it's really, I think, our statement, I feel like it's very clear. We try to be detailed just to show you guys where we were at. But our reaction really came from the experience and the process that we saw during the November 10th meeting. So in the packet today, I did see it, and it had a very detailed information on the entire process. And I feel like maybe at that point, those weren't so evident at that meeting. So that's where we kind of reacted a little bit more. And also just what we saw and heard at that meeting was that some committee members were not prepared to make decisions, stating that they had either not read the packet or gone through the applications. And then the other piece of it in that meeting was that the staff recommendations were shown at the beginning of the discussion, even before the applicants had a chance to answer questions. And that's where some of the participants or the agencies felt what they would call, right, they were naming him as shame, in saying like, okay, we're talking about it now and answering some questions, but almost knowing that they have not been chosen. So that's where it didn't feel good for the applicants. So we're really just hoping that, providing the feedback on that experience, seeing that how can we consider the process moving forward, right? Or in the future, being mindful of all of the people involved, and just being maybe in the process more transparent before and not after the fact. Discussing, with the referring partners or asking for input, and maybe even ask, kind of considering certain things that we have outlined on our statement, and even more so, right, thinking about maybe bringing an expert panel to give you guys feedbacks on the needs, the gaps, or whatever else you guys need to know in order to make a really good decision, because this funding source is so important, especially for the nonprofits. We've waited 2 years for this type of funding to come from the city. So it was so important. So if, we just wanted you guys to be a little bit more mindful, and that's just, once again, it was just our experience. So we're just kind of sharing that feedback. So then, also talking about just what to consider, right? As you guys review this again, and that's where we tried outlining it as clear as possible, and looking at the initial 3 bullet points that we had on there in terms of connection to the community, the sustainability, and also the, what's going to be a good fit for the client. So Allie, if you want to jump in, and she'll kind of put a little bit more into context, so that way it's not just a lot of words on this piece of paper.
Hello, can you hear me? Oh, and you get to see a little thumbnail picture of me and my son.
Yes.
So hi, everyone. I'm Allie Harned. I am a social worker in District 65. I've been in the district 19 years now, at a few different schools. And my current role is as a district-wide social worker. And one of the things that I do is to try to help facilitate wraparound plans for families. And I know you all talk about wraparound a lot, and the service providers talk about wraparound a lot. And so we all are like working together to try to wrap around families and really be able to support them in any way that is needed to help them thrive in their community and in their whatever their situation is, and reach whatever goals it is that they'd like to reach. So in the school setting, we have students and we support them academically, we support them behaviorally, or whatever is really needed in the school setting. But there's often needs that arise that the family is struggling with that may be affecting a child. So if a family is housing insecure, the child might not be getting a good night's sleep, or they might be riding really far to get to school, or they might not have electricity. Those kinds of things that can really affect a kid in school. So the wraparound process is meant to try to support these students and their families to see what can be done. And it's essential to have connections with community partners. And so in our letter, we talked about the kind of 3 like categories or prioritization of values that we thought would be helpful. And I thought it might just be helpful to like hear a little illustration of what wraparound can be and how these values might be helpful. So we talked about connection to the community, sustainability, and a good fit for clients. So there's lots of families that a lot of us community partners are working with, but there's a family that I want to highlight, and I have their permission. I'm not going to give any identifying details at all, but it's a generational family. They've been in Evanston for generations, and there's several different generations living in one home. And the head of the household for many years became sick during COVID and passed away, unfortunately. So another person became the head of household, and they've been really struggling and fell behind in rent, and we're having a hard time. And all of a sudden we're in charge of all these different kids and trying to keep it together with what their needs were in school and what benefits they might have or not have. And so they were really sort of having a hard time. And the Moran Center came in and was able to help them with their eviction proceedings. And fortunately, like, they did not end up getting evicted. They are still in their home. They're still looking for a new home. If anybody has any homes available with 4 to 5 bedrooms, we're still looking. There's an article in the Roundtable about that need today. But the Moran Center was like essential in this, and they brought in me. They brought in District 65. They brought in Back on Their Feet, a local mutual aid group that really is able to do fantastic work. And then as this kind of team has developed, we've brought in, just last week, we were on our weekly team meeting, and I texted a City of Evanston youth and young adult outreach worker who's fantastic. And he hopped on the Zoom and joined our Zoom and was able to do a little bit of intake. And the next day they were buying groceries for this family, like helping them out. They're just able to do phenomenal work. Family Focus is involved. This is one of Miss Joanne's kid. Miss Joanne's famous. I'm sure I can say her name. So she knows this family, and now she's working with another generation of the family and wrapping her love around them like Miss Joanne does. So just being able to have the connections and knowing who's who in the organizations really helps us. Like, when we meet as a mental health task force, we can talk about what the needs are. And then I get information every time we have a meeting that I'm like, oh, I can put that to use to support some families. So I think, like, having the connection to the community, having a footprint that's really like longstanding and wide reaching is a very like important characteristic to have, so that you know that like they're reliable and they are going to know who to call and what to do in any sort of situation that a family might have. And then the sustainability is like, we really want, none of these crises are short-lived, like, and nobody ever has like one need. It seems like there always are like multifaceted needs that families have. So it's important to be able to have a plan for sustaining after this fee-for-service funding runs out. Because Kathy was saying last time, like, it's not a whole huge pot of funding. It's not a pot of gold at the end of the rainbow. Like, there are limits to it. So it is important for the road to not end, for there to be a pathway past the funding. And then the good fit for clients, I think it's just important. Like, when people are working with community partners who have a reputation and have been around forever and have worked with, generations before them, like, people come in with inherent trust, where there's so much distrust because there's been so many institutions and systems have failed so many families, and that's why they're in the situations that they are. So the more that we can start with a foundation of trust and longstanding work and trying to work on breaking down the systems and making them work better, I think the better that will be in our path going forward and wraparound. So those are just some like things that have been on my mind. And I could tell you like 10 more stories about wraparound cases if you're interested, but I know that you have a long meeting ahead of you. So I appreciate the opportunity to talk, and I'm happy to answer any questions if anybody has any.
Perfect. Thank you so much, Cindy. Thank you so much, Allie. And I think it's really important. And actually, I'm glad that you raised this piece about wraparound and sort of the model that we are building, is that the discussion last month was on one piece, which was just the mental health services, and not the full array of services that the Social Service Committee is funding. And really where I feel, and Jessica or Sarah, feel free to sort of, we can walk everybody through it again, but this was just counseling, group counseling, and individual counseling. We have the care coordination work that is that sort of wraparound, and then we have safety net services, which are those like housing or food or, and there are various ones, but those sort of safety nets. And the piece we talked about on November was just that mental health piece. So I think that's important, because if you're looking at what we discussed in November, you're right, we are missing the wraparound. We're missing that care coordination piece, but that's because we funded that and are actually going to discuss, I think, a little bit more later today, but we funded that and made those decisions earlier. So the piece we did in November was really that third leg of the stool, and had been having discussions throughout the past year of sort of getting to that. And it was recognized that group and individual counseling, were, I think, one of the biggest pieces that are, and Jessica, jump in, you've had more conversations on this than I have, that the referring agencies said they struggled with, was that those pieces. And so that was what we discussed in November, was just that sort of third leg of a very important leg, but just the third leg of the stool. So I'll pause there. I just want to make sure that piece is clear, because it might not have been.
I totally hear that. I guess I'm still not muted. And I totally understand that and I believe in it. I think that the three-legged stool, like there's probably 5 more legs that need to be put in place as well, to really do good work. I think what we're saying is like having the connection with the community for the mental health practitioners is really helpful, because it is history, it's a foundation, it's a maybe building some more trust. And mental health services are very stigmatized and can be really tricky getting into for many communities, and for very good reasons. So it's important to just consider those things.
Absolutely. And that is why we know we needed both individual and group. We wanted a wide array of individual practitioners, with a real emphasis on diverse practitioners. Study after study, as you all know, has shown that when your therapist or counselor or social worker looks like you, has a familiar background, you make far more progress much quicker, because there's that shared trust, that shared experience. So we did look at that. That was one of the things that was, I think, of great import to all of the committee members. So I do see that. We also wanted distinct locations. We talked about how close they were to public transportation. If they weren't located within Evanston, where did they do their group therapy? Were they located, and could they be? Would they travel? Would they go to a school, recognizing that was sometimes important, as would they go and offer group therapy at Nichols or Haven for a group that really, are adolescents, just as I don't have to get into our adolescents and just the struggle that they are going through here in Evanston, and of course nationwide. So those were things that we did discuss and did. We could not agree more. That a tie to the community is important. We also talked about sustainability. We talked about, how many sessions were on average, what was their, familiarity, especially for children with the Medicaid program. I believe one of the agencies that we did select, they are, they bill Medicaid. They are very familiar with Medicaid. We have one that does not. But again, really trying to find sustainability. And I believe it was, I don't want to put Kathy on the spot, but it was the one that did not accept Medicaid. They had that foundational support. She asked about that and understanding, what we don't want a cliff. And so these,
Mhm.
we agree. I mean, these are important things that we did absolutely consider and discuss in our meeting, both in November, but in previous meetings. So we have shared goals and priorities there.
And,
From my
and
point
these,
of view.
yeah, and these are things that we definitely, as we had discussed before with your group, Ally and Cindy, these are things that we definitely take seriously. And we wanted to make sure that the gap was filled with practitioners that were able to respond. It is new. It is a different concept, but at no time are we interested in not supporting the services that we already have that are close to us, and that feed our community on a daily basis in mind, body, and soul. So it's our hope that we continue the relationship and the communication. Plus, we wanted to build in a resource in which, if this does not work to the level that we think is appropriate, we can stop it and reevaluate. We don't want to go too far without getting some checks and balances and outcomes that we also discussed that are very important to you as well as to this committee. So this may be a bit different, but we are not leaving or losing any of the relationships that we already have established with organizations and agencies in the community that have been the stalwart of mental health support for years and have developed, as Cindy and you have articulated, developed that trust and infrastructure. We only want to enhance it. And we have also put in and built in reviews that if we don't get the outcomes that we're interested in, then we stop and we adjust and pivot and do something different.
Chair, I just wanted to signal that we are still in public comment. Technically, we have not officially moved the new business in old business, which is discussion on vote to maintain or modify mental health providers. I also have several, questions and comments around this issue, but I wanted to make sure that we finish. I want to understand whether or not we finished public comment yet, and we want to officially move the new business, or if we have other public commenters.
Perfect. Yes, we are still in public comment. I wanted to make sure Cindy and Ally and anybody else raised what they wanted to raise. I want to make sure they have outlined everything they need to and make sure there's nobody else. Again, we will have public comment again later in the meeting. So if something comes up and you don't raise it now, don't worry, we'll have public comment a second time. But any other comments right now, Cindy or Ally, before we move to the next piece?
Yeah, just the last piece on my part is, I hear everything you guys are saying, and I appreciate that you guys are hearing us as well. And yes, the focus on this is mental health services. We completely get that. I think when we were outlining it, it's more saying that with just the direct clinical services comes all these other pieces. So that's why we want to be mindful of realistically the clients you guys are going to be referring and the referring agencies. Most of them will fit into realistically a nonprofit sector just because of the adaptability and flexibility of what we do. And we've been doing this for years. So we talk about the 10 sessions, right, that you guys are funding with this. And it's definitely helpful, but there's so much more that comes along. And even though the funding is going to go just for that, I'm sure these agencies are going to need to do more and will probably do more. So when you think about that, then you have to look at overall, right? Like it's just a nonprofit is the only one that's going to be able to allow you to do, and kind of fill this gap in a way. But that's it. Sorry. Thank you.
No. And thank you so much, Cindy. All right. I'm going to do one more request just to make sure we're not missing anybody. And then we'll move to the next item on the agenda, Councilmember Burns, which is just the review.
I just want to say thank you. Thank you for listening to us. Really appreciate it.
Absolutely.
All right, if it's all right, I'm going to remove your permission to talk, Cindy and Ally. This should not boot you from the meeting, but like I said, if it does, please join again. Okay. I think we're good.
All right, so now, Councilmember Burns, we are in discussion and vote to maintain or modify the mental health provider recommendations. And I believe you indicated already you have some questions, so why don't we start with you?
Do we need to officially move? I can.
I need a motion, right?
Yeah.
I do. I was just moving right ahead. I have a
No, it's all
motion
good.
and I need a second.
Yeah, I'll move discussion for this item. I lost
Thank
my place, but
Perfect.
yeah, I'll move this under new business discussion and vote to maintain or modify mental health providers recommendation to city council.
And do I have a second?
Second.
Perfect. And Jessica, will you?
Yes, Chair Olds Fry.
Yes.
Okay, Councilmember Burns.
I don't think we need to vote on it yet.
Yeah, okay,
Okay.
good.
Okay.
Yeah, we're just discussing it.
We're just discussing.
Yeah,
All right.
we're discussing first, and then we'll see if there's anything we need to do next.
Perfect. Councilmember Burns, you had some questions or some items. I think, well, why don't you kick off the discussion?
Yeah, so I guess so to pick up on what we heard during public comment, I think one of the biggest concerns was the recommendation to approve a provider who is a for-profit business and then also provides a sliding fee scale and has a foundation to support clients, but does not accept, I think, Medicaid. And so if we can, I'm sure we have the provider with us today who can speak directly to, their sliding fee scale and the foundational support and how that works. So I think the concern is that people will, sign up to receive services for this provider. I think it's 6 sessions or whatever it is. And then once the city money runs out, then what? And if it's one thing to say you have foundation support, and I don't know, this is why I'd love to hear from them, but how much money is it? Is it replenished, on an annual basis? Is there some type of endowment? So, there's an ability year by year to increase the amount of, clients that are served. So I think that level of detail would be helpful at this point if there are concerns about this.
Absolutely. And Jessica, they are on the call, right? Or the meeting?
Yes, all of the providers are on the call. Yep, so let me find David Clow is here from Skylight.
And I do want to, as David is joining, I do want to point out, we did discuss, and Amanda's not on, but we did discuss from like a clinical point of view, sort of that number of sessions and to get some sort of clinical comfort with that exact concern also, Councilmember Burns, because I think we all shared that wanting to avoid that cliff. And so there was some thought that the number of sessions did seem clinically appropriate as well. But David is on now and can, you are muted, David, but I think you go ahead and kick right off.
Oh, great. Thank you. Yeah, thank you for the questions. Specifically, we have sliding scale services with our clinical interns who are therapists in training, mostly in master's or PhD programs at universities in the area. And what we've done over the years, we've had similar arrangements with organizations, sometimes universities such as National Louis University or Illinois Institute of Technology, where when the funding from that third party payer runs out, we move the cases to our interns who see them at no cost or nominal cost to the clients. Those interns do graduate each year and then new group comes in. So that's one method that we've used for maybe 10 years now to provide affordable counseling in a private practice setting. We are not a nonprofit agency, the Skylight Counseling Center. The upside of that is we tend to move quickly. Our staff are well resourced and well supervised, and are getting continual training. But our foundation, which we started in 2019, does not have an endowment. We currently have 26 clients, either individuals or families, that receive ongoing counseling. We've done with that model more, rather than limit the numbers, we just commit to people as ongoing until we see resolution of their presenting issues. So we are constantly doing fundraising on that side. We have some private grants and donations, as well as some municipal ones. The Niles Township has given us continual funding over the last 2 years. And then we develop relationships, like in Q1, Evanston Space will be the nonprofit that's on their list to give to people can contribute when they buy tickets to events. So those are the various ways we try to keep funding going. But yeah, we don't have an ongoing endowment per se.
And I just want to understand you said the interns, when you mention the interns, is that the sliding scale fee program with the foundational support goes towards that? I just want to understand the interns.
Yeah, yes. The interns are not in the foundation. They're working through the counseling center, are supervised by fully licensed clinicians, and then the client pays either $0 or $5, $10, somewhere in there, depending on what the client can afford. Sometimes a fee helps just for buy into the process, but we don't require that. On the foundation side, it's fully licensed clinicians who normally would be working pro bono for these cases, but instead we're paying them flat $50 per session.
And how in your opinion, and then also would love to kick this to the committee members, how do the interns do with some of the more difficult cases? And is it a practice to give them difficult cases, or how is that managed?
What they lack in experience, they make up for in eagerness and freshness. They're not as exhausted, but we do have layers of clinical support, not just their supervisor, but we have a clinical team that supports them, especially with difficult cases. Even if they're the point person doing the therapy, if needed, we can bring in the therapist's supervisor in there to do some consultation on a tough case. But for the most part, if the client is presenting with issues that are appropriate for outpatient mental health counseling once or even twice a week, then the interns should be qualified with the support they have to provide those services. But if for some reason the client needed higher level of care and more intensive outpatient or even inpatient treatment, then we would be referring out anyways.
And again, not a therapist or a counselor. I really rely on the rest of the group who do have experience in this area just to educate me about is this best practices, because I think we've heard and the assumption I'm making is that if we were to go with a nonprofit, that they would have kind of more skilled, more experienced, I'll say, therapists and counselors working with all their clients, no matter the kind of level of care needed, and that here they would be seeing interns after the kind of city funding runs out. So I'm just trying to understand, is that a best practice? Do we feel comfortable with that?
Yeah, Jessica, go ahead, and I have some thoughts too, but go right ahead.
Thank you so much. So I would also just like to jump in and say that in the application, all applicants were asked about sort of people presenting with milder symptoms and then people presenting with more severe symptoms. And there was discussion at the committee level about perhaps extending the number of sessions the city could support for people who are identified as severe. It is my sense that the providers could identify those participants earlier on in the process. Certainly, I would say like and you know, I am also not a practitioner, obviously, so please correct me if I'm wrong. But after talking to the referring agencies, the goal of the program really is to provide sort of immediate support for participants, and then those who do require longer term care, that plan is evolving. So,
and I think on that, I think it's worth noting that in those instances, the members that we're serving likely would be eligible for Medicaid or a state-funded health program, and that if they needed additional services, I think that's where Skylight and likely many of the organizations that applied would need to refer out. And why I say that is I don't believe many organizations had inpatient. I don't think they highlight that applied. I know that there are, I know that obviously there are inpatient services here in Evanston, but that they, or intensive outpatient. Again, a lot of the groups that applied, I don't think, that's sort of in their wheelhouse, so to speak. I also think it's important. I don't know that the not-for-profit model exclusively, I mean, we see great value in the not-for-profit model. And I do think that they do just amazing, amazing work. And we are very grateful for what they do in the community. But I do think that there are just as amazing therapists in private practice as well, that are just as committed. And I just think that I think that's important to know, that there are qualified, passionate therapists in both sectors. And that honestly, if somebody with resources were going for therapy, the likelihood that they would end up at a for-profit private practice is probably very high. I mean, that's likely where somebody with resources would go. So sort of recognizing that there's some health equity component there too, of trying to make sure that there is, we're providing access to the best of our ability. Kathy?
Thank you. I just had a very quick question for Skylight. What is the hour requirement for your interns to serve? How many hours are required by their institutions for them to serve in Skylight? And once they have served that time, what is the reviewing process that is given to their institution?
Most of the interns are in their second year of their training program. If it's a master's program, if it's a PhD program, they may be even farther along. And they usually come in needing about 250 hours or so of clinical, face-to-face clinical services, and then a certain requirement of weekly supervision as well for a year. We do quarterly, sometimes semesterly reviews that the schools send us. We complete them, and then at the end of the year, there's kind of an end of the year review that gets sent back to the school as well. Sometimes even with a grade recommendation if the internship is for a course. A lot of times we end up hiring our interns and they stay on with us as a staff person post-graduation.
May I be so bold as to ask, where are some of the institutions, educational institutions, that these graduate and PhD students are from, please?
Yeah, historically we've taken students from the counseling program at Northwestern University in Evanston, Adler University in Chicago, National Louis University. Those have been our main ones, but we get applications from students all over the city, including Chicago social work, Loyola. But we have some closer relationships with Northwestern and Adler, so we've tended to go in that direction.
Thank you.
Welcome.
And I think the reason why I ask this is that again, if it is appropriate to correlate skill with experience, and also assume that the nonprofits will not use less experienced interns to provide services to the referred participants, then I don't see how we rate Skylight above another provider. And this is coming from somebody who, supported Skylight the first time around, and still like it's still like several components of what they do, and still may support them, but just for the sake of the discussion, because we've sent it back. And for those who are in the audience and waiting to participate in upcoming agenda items, I apologize ahead of time, but this was essentially sent back for a reason, so we could have a different discussion, or so we could try to dive a bit deeper into certain areas. So again, forgive me in advance, but this is what we're here to do, or we should have just approved it at council. So yeah, so I want to put that out there. That's why I'm asking. Unless we're saying that we believe the interns will provide the same level of service, then how are we rating them above the other agencies?
And David, please correct me if I'm wrong, but the interns would only be there if after the number of services, the interns are there to prevent a cliff, but that when we would be referring, they would not, that's the probably third step. The first would be the original, was it 6 or 8 services? I cannot remember, Jessica, I apologize.
No, that's okay. When you say 6 or 8 services, do
6 or
you?
8 sessions, sorry.
Oh, right. So it's 6 sessions. Again, for milder cases, we have a 6-session cap.
And so then for more severe cases, we could authorize more, essentially. And those would all be with and David, make sure if I'm understanding this correctly, those would be with your traditional licensed clinicians, those full licensure. And then if for whatever reason, those amount of sessions, which again, we spoke with at the time, Amanda was on, who's a clinician, and she indicated, I'm also not a clinician or practitioner, that seemed really quite standard, and that for mild cases, that number seemed appropriate. And so my understanding then is the interns are just sort of as that third piece. And so David, jump in and let me know if I'm right or wrong, if I captured that right.
Yes. And any case that would come in through this grant would go to a fully licensed clinician who would be paid for their time. And then once those session max is reached, we'd figure out what the best clinical plan is for that client. If it's possible to, for the therapist, we'd have some sort of process where we could request more funding for another round. Maybe that would be an option. Maybe we would refer out, but we'd also be able to refer in either to our interns, or perhaps if there's foundation funding through us to keep the client with their therapist. And then instead of the city paying those sessions, paying the therapist for the sessions, our foundation would. So yes, none of the City of Evanston cases would go to an intern directly, right? They're a backup. We actually, in our experience, when we had the exact same model with National Louis University, they didn't have their own counseling center for years. They hired us. They had a 6-session cap for the academic year. We would, a fully licensed clinician here would see them. And then once the treatment ended, they would get transferred to an intern for continued care. One point that I think could be made, which would be a good one by another organization, is that it can be a clinical issue if then you have to switch your therapist. Funding runs out. You're fully licensed therapist, you know, there's no more funding. Now you have to go see an intern. That could be a clinical issue. Whereas if at an organization they had more funding, the client could stay with their therapist. I think that would be optimal. But I do appreciate what you spoke to about the equitability process. We try to have the experience be that whether you can afford therapy or not, that hopefully you get a very similar experience as somebody with the funds.
And just to I think that's the first point that we both, they both, what we heard in public comment is referred to as kind of sustainability. What I think, Samantha, you referred to as like this, not, this cliff that we know is coming and we don't want to, folks to fall down it. That's like the first concern, is just that after the grant funds run out, someone is, if someone is at Skylight, as David just said, will they be able to continue with the therapist that they, have built this rapport, this relationship with, which is an important part of that, of the process, obviously, and it may take time. I would imagine to establish that kind of rapport and trust between the practitioner and the client. And so that's like the first concern. But in addition to that, right, if you don't accept Medicaid and we are able to sign someone up for Medicaid, but it's not accepted. And so that the only option for you is to either get foundation support, and then I think then maybe you can continue to see the same therapist, or you can pay a sliding fee scale where you'll have to work with a new person who's also less experienced and again potentially less skilled than who you were seeing before. It's workable, but what I'm saying is, why would we rate that something that requires requires foundation support, that switches the practitioner potentially? Why would we? What is the benefit to go through all those hoops when we have other providers who can provide a bit more sustainability and consistency? That's what I'm trying to understand.
Yeah.
And again, this is coming from somebody who supported them before, but we're back here just discussing it. So let's dig into it.
I think Councilmember Burns, I think it's a great question. And actually, I was the one that started asking, who do you accept Medicaid? I care. My day job, I am a champion for the Medicaid program. It is our social, healthcare safety net. It covers 50% of births in the state. It covers over a third of the children, nearly a third of the state population. It supports your friends, your neighbors, your family through some of the most challenging times. It is the largest payer of long-term care and behavioral health care in this state. It is essential. And unfortunately, not enough mental health providers accept it. There were many providers, not just Skylight, that didn't accept Medicaid. That applied for this. It was actually, I was disappointed, I guess, or reminded of the disappointment that exists, and that the opportunity for improvement that our Medicaid program still has, and Medicaid programs across the nation. This is not unique to Illinois. So I share your, the ideal would have been an organization that accepted Medicaid, that did both group and individual therapy, that had capacity to serve a large amount of folks, that was located by L or public transportation. But I think that was the ideal, and that had diverse therapists. And I don't know that there were other groups that sort of ticked every single one of those boxes.
I guess that's important to just to staff. Is that staff's position that there are no other agencies who we did not approve or recommend approval of funding for that do not check those boxes?
So I can say that some of the, like, if an agency wasn't able to provide group counseling, that put them lower down on the list. If an agency couldn't provide services at discrete locations or independent locations, that moved them lower down on the list. And again, all of the agencies provide amazing services. They are all very strong. You know, this was a tough application process because the agencies are so good. But there were little things that not even little things, but there were key service elements that I think made certain agencies stand out over others. And I would be happy to go into more detail or discuss that further until the committee and the public feel comfortable. But it was also, you know, the cost of group and individual sessions, and how could agencies or how people could maintain services, because there was a range in the number, the cost of an individual session for some of the agencies. David, if I could put you on the spot for another moment. Another thing that was unique to Skylight was the ability, again, for a fee, but something we could work out, for participants who were involved in individual services to then transition to groups that Skylight already offers as a way of maintaining ongoing support. And the groups that Skylight has to offer are unique and exciting. And I think from what I've heard from the partners who would be making those referrals would be beneficial. So
Can you quickly highlight some of those groups? So David, if you could quickly highlight some of those groups.
Sure. Yeah. Some are just interpersonal process groups for adults where it's just kind of a support group to talk about what's going on in our lives. Some break down by presenting problems. You could have a group for people who are experiencing trauma, but we do have groups that divide by presenting population. We have a group for Black women. We have a group for teens. We have another one for geek therapy for gamers, so adolescents who are into that to kind of help bring them offline a little bit. So pretty much even if the populations are different, some of the theory of how we do groups is similar across the board in terms of the healing power of the group, sharing, witnessing one another's experience, also sometimes looking at the dynamics of what's happening in the group. But I taught group therapy for 10 years at Northwestern, and just believe in the power of groups to help people. So that's what we tend to do. We've done a lot of groups where we've gone on site to locations, various schools and organizations. So sometimes that lends itself if the members are already there, and then we can kind of quickly pull a group together for usually about 75 minutes.
One of the unfortunate parts about this meeting is we don't have all of our members, because I think with this discussion, it would have been helpful to have more of our members here, especially those who are practitioners. So I would love to hear their feedback. So that's the concern there. I would love to know for Impact Behavioral Health as an example, what, Evanston, not near a train station. I'm just trying to see, where do they stack up on that checklist? Medicaid, don't accept Medicaid. Do they do, individual lane group? Do they have diverse staff? How do we feel about Impact Behavioral Health and their application?
Yeah, Jessica, do you have that? You can walk through. If I recall, they do not do group.
They
Is that
do
right?
not do group, yes.
Okay.
2 of their 5 clinicians identify as BIPOC. And I believe they do have bilingual staff. But I would need to dig a little bit deeper in my notes to see who in their staff is bilingual. And what I mean by that is, as an example, there is another organization who has bilingual staff, but their bilingual staff member was an intake coordinator and
Not the
case
therapist.
manager, not a therapist. Yeah, I don't believe that is the case with Impact, but I don't have that information in front of me. The types of counseling Impact provides were very much in line with best practices and all of the other sort of therapeutic approaches that all of the applicants provided in terms of motivational interviewing, cognitive behavioral therapy, dialectical behavioral therapy, eye movement desensitization and reprocessing. I've gotten very familiar with a lot of acronyms over the past couple of months.
I'm sure.
Impact is they provide wonderful services. They're a phenomenal organization. They do.
But the concern was group, though. The biggest concern was that they didn't provide group therapy.
Yeah. And it was also around the capacity of new individuals. Yep.
Hey Ken, I think Brian Rowland your son?
He is.
I'm gonna tell him you were quiet on your first meeting, man. Come on.
I'm learning.
No, I hear you. I hear you. That's I hope you recognize me, Bobby Burns. I grew up with Brian.
I do, Bobby.
So so group, and then I hear BIPOC, I hear that, but more specifically, does Impact Behavioral have anybody? This is a question for Skylight as well, that identifies as a Black male.
I'm sorry, your question is, does Impact have any
Does
clinicians
Impact?
who identify?
Yeah, same question for Skylight as well, but starting off with Impact Behavioral Health.
We do have members of Impact here. Okay, thank you.
And Councilmember Burns, you specifically want a therapist though, right? Like
A
not
therapist.
Yep.
Yeah, sorry. Thank you, Samantha. Yeah, therapist.
So I've invited Chris Nober from Impact to give us more information.
Can everybody hear me?
Yes, Chris.
All right, awesome. Well, thank you for the great questions. And just to answer those, I'll answer those specific points. We do have both case management staff and employment staff that speak Spanish, but we do not have, we do have a bilingual therapist, but that therapist speaks Greek. We have 2 African-American female therapists, and but we do not have a Black male.
And just to make sure I heard that correctly, do not have a bilingual Spanish therapist.
Correct.
Okay. And then same question for Skylight, if you don't mind.
Yes, we do. We do have a Black male therapist currently on staff. Right now, we have 1 Black male therapist.
With availability, because I know how
Yes.
case flows go with availability with space.
Currently he does. His name's Robert Lloyd. He's actually also serves in an administrative role, leadership role as director of community counseling services. So he would, along with Aisha Pointer, who's his co-director, be kind of our point person a bit with the city to, if we are chosen to kind of help oversee this program and make sure that he and other staff members are available to provide services. So Robert would and Daisha would be kind of who we were looking at to kind of be our point person to interact with the city on this if we were chosen.
And to the question of the bilingual Spanish therapist.
Yes, we have 2 right now. One's on maternity. Third is on maternity leave. Will be coming back this year.
Okay, and then last question for now, and then again, I'll kick it back to the group to see if there's anything else. But I also heard some concerns about MFS, Evanston Mental Health Metropolitan. Heard from, some of our social workers in the community that while they have a kind of long history in Evanston, as I understand it, that they may have not been around for a while or as active as they once were. I think is more closely to what I heard. And so I don't know if they're on the call, Metropolitan, and they can talk about if they could speak to just the kind of their history in Evanston, and then, over the past, let's call it 5 years, do they see themselves as being less active or more active, or if they could talk to us about that. Hopefully that's clear. I'm trying to remember all my conversations. Thank you.
Yes, and I want to, as we're promoting Metropolitan, or Kathy, you had your hand up, but it is gone now. I don't know if.
Yes, Bobby pretty much answered my question, but since I have
Perfect.
the opportunity now, I will ask Skylight, are there any other languages that you have access to that for patients, whether it is French, whether it is some of the Asian languages, or capability to have that translated for into some of those languages?
Yeah, we have somebody who speaks Japanese, and let me check. I feel like there was one other, but I know there was Spanish and Japanese, potentially French. When it comes to translation services, we've still been trying to figure out how we do that from a confidentiality standpoint. We've had kind of an ASL interpreter for a case, but with appropriate consent, if the client is okay with the interpreter being there, that's something we can certainly explore. But I think there's something about therapy being done in one's native language that is very different than when you have to translate. So finding, just as you're talking about having the practitioner mirror the client in various ways, I think the language is it's pretty key. So yeah, Spanish and Japanese for us.
Jennifer Jenks is here from Metropolitan Family Services, and if I can put her on the spot, I would love to.
Jennifer, can you hear us okay?
Jennifer, oh yeah.
Yep.
Oh, yeah.
You unmuted, and then there we go. And we can see you.
Hey, hello, how are you?
Oh, very good. Thank you so much for giving me the opportunity to speak. I'm Jennifer Jenks, and I am a program director with Metropolitan Family Services. Metropolitan has a long history of providing services for Evanston residents. We have for many, many years had a program called Family Support and Prevention, and we've had bilingual staff who have served Evanston residents for case management and therapy. Right now, we don't have that position in Evanston, but we have a behavioral health team that serves Evanston and also.
And Jennifer, I'm sorry, I missed, my phone broke up. You said you don't have what position in Evanston anymore?
The Family Support and Prevention Program was a program that was funded by the City of Evanston Mental Health Board. It was recommended by the Mental Health Board and funded by the City of Evanston for years. So we have had a long history in Evanston, but we also have behavioral health program that has also been around for years. And we serve many, many residents of Evanston currently in that program. We have 3 therapists. We have a licensed clinical social worker who supervises those therapists. I'm a licensed clinical social worker, an Illinois certified domestic violence professional, and I'm the director over that program. We also have a case manager, and we are in the process of hiring a peer. So we have a really nice team model that we have put into place. Our therapists, we have the case manager and one of our therapists are both bilingual English Spanish. We have another therapist who is bilingual English Assyrian. And we serve with also LCSWs. We can serve clients with Medicare, Medicaid. We take a variety of private insurances. We have sliding scale. We also at times will, we make exceptions in terms of having clients and taking clients unfunded. That is rare, but it does happen, and we can make those exceptions. We also help clients to get Medicaid, right? So as part of coming into the process, if someone does not have Medicaid, then we would help in terms of being able to sustain those services for the clients. So our behavioral health services in Evanston, in Skokie, and in the surrounding areas, they've been incredibly strong. And they have been strong for many, many years. So we also do, I'm sorry, just a couple of things.
No.
So we do home-based services. We're one of the agencies where we go to clients' homes. We do case management in the community. So good examples would be if somebody is having I'll use an example of where they struggle with leaving their home, right? We will go and do home-based work. We'll help them to take those steps that they need to be able to get back into functioning for their lives. So we go to schools. We have a lot of clients that we see, and we go into the Evanston schools. For many years, we had a partnership with District 65, the Family Service Center. We ran groups for them there. And so I think that just basically kind of to answer this question, that we are very committed and very busy in Evanston, in our behavioral health program. Thank you.
And Jennifer, okay, sorry, something switched. And what I heard even more specifically is that, and this is only coming from one person. So I'm not saying it's it would be helpful for you to react to it though, but I'm not acting as though this is a fact or truth.
Right.
But is that people felt like this person that felt like they had reached out to Metropolitan over the last few years and didn't hear back, trying to refer people and hadn't heard back. Has there been any big transition recently within the organization that has caused any, lapses in communication with people who are referring clients or?
Well, and not that I'm aware of. I mean,
Okay.
we have so many referral pipelines, and I think we, again, with the number of clients that we serve, we are able to get clients in. We do sometimes we do have a waiting list. So that happens. And we have worked we really have worked very hard to try to limit that. And now with our expanded team model, right now the waiting list is almost non-existent. So there are maybe a couple of people who are on the waiting list, and maybe they just need to be contacted. So we will have immediate immediate availability. So
And then-
I would say if somebody, there are times where we have staff turnover just like everybody else.
Sure.
And so we might not be as active in the LAN. We used to run the resource fair for 3 years. Metropolitan was the agency that basically ran that and put that together, but with staff changes, we haven't done that for the last couple of years, but it's also okay for other agencies to take the lead in some ways.
And then last question for Metropolitan, at least for me, is just any therapist who identifies as Black male.
Black male, unfortunately, no, we do not have.
Okay.
Black. Or Black female, and I certainly wish we did, but we don't right now.
Any other questions for Metropolitan? I did have some questions about Turning Point.
Yeah,
And-
Jennifer, could you get Councilmember Burns that a contact, or perhaps it's you, for whomever was trying to refer to you guys,
Oh,
and it was breaking down? That might close that loop, just because it might be for a different project or a different program, but we will. I imagine you don't want a broken referral link
No.
somewhere, so that way that one person can get to the right person. Would it be all right?
Oh, of course.
Perfect. And then before we turn to Turning Point, no pun there. Kathy has her hand up, so I want to make sure she gets her questions answered.
Alderman Burns asked pretty much many of my questions. You said that at one point there was a staff turnover. When was that turnover by chance, Miss Jink?
Yes, so we had a staff turnover we had a staff who had been a long time with the program, and then that staff left the agency, and then we were in the process of hiring, so it took us a few months to hire. And then we did hire, we had a family coach position that we had in Evanston that was directly in the city. In addition, obviously, to our behavioral health, but this was on a separate program. So we've always had, the behavioral health program has always been there and has always served Evanston residents. With this other program, this staff left in the summer. She moved out of state. And so at that point, we have left it just to be that our behavioral health program is serving residents. And when this opportunity presented itself, you'll notice that we are not funding, we didn't apply for case management, which we have done in the past, and we have been funded for many years for case management. But this year, but then we decided to go the route of with the different levels. We thought that the behavioral health route would be the best route for us at this time.
And that would be more inclusive with wraparound services, is that?
Oh, absolutely. Case management, peer support, home-based visits, school services, all these types of things. And the wraparound involving, like, clients come in and then we'll figure out like what are the specifics that they need. And also parenting services, obviously. So for children, if their parents are needing services also, then we are there to support parents and the children, working with families. So.
And one last question, do you all recruit from cultural organizations like the Black social workers, the Indigenous associations, and so forth from the different?
We do not,
fellowships?
yeah, thank you. We do not recruit. We do not recruit for, are you talking about for staffing? Or are we talking
For staffing, I'm so
Oh,
sorry.
for staffing, yes.
Yes, ma'am.
For staffing, we have had the staff at our offices for quite some years. Our team has been very stable. We have added staff, and we have not recruited from those two organizations. We do require all new positions to be bilingual for the most part. So for the most part, we always want to make sure that we are providing services in Spanish, in English, and then we'll also look at other languages, as I mentioned, Assyrian. But no, that is not a specific place that to my knowledge, and I'm over the program. So
Thank you.
yes, you're welcome.
And Chair, if you don't mind, just one more question from
Go right ahead.
names, for Metro. Did you mention something about the local area network?
But yes, the LAN, yes. We have not been as active in the LAN, and that is again just due to staffing. And I know that I'm on the emails, so I definitely see all the emails. We have other staff who are on those emails also. But we have been active in the LAN, very active in the LAN in the past. And right now that is not, maybe that's where that's where the information came from in terms of, are we in Evanston? But we are absolutely in Evanston, doing the work with our behavioral health teams.
Is LAN is that an Evanston only network or?
Yes, the different communities have these, the local area networks where agencies network with each other.
Okay, I see.
Yeah.
And so, so Metro used to be in this kind of local Evanston network. You used to be more active in it, and the organization has been less active over the last few years.
Over the last year.
Over the last year.
Yeah.
Okay.
Yeah.
Okay. And then last question on that: what is the benefit of the network? Like, what value does it provide?
Well, it's an opportunity for agencies to come together to talk about their resources.
Okay.
And so, like I mentioned that, for instance, I'm on the email. So if somebody has a question about something, they might send out an email. Or if somebody is going to run a group or provide some services, they might send out an email. So it's an opportunity to connect. And we've had staff in the past who have attended the meetings. And again, for 3 years, Metropolitan was very active, and we ran the resource fair. We organized the resource fair, things like that. So over the last year or so, we've taken a bit of a backseat to that, but that is not in any way affected our serving Evanston residents in our behavioral health program.
Perfect. Thank you.
You're very welcome.
All right. And then Councilmember Burns, you wanted to talk with Turning Point. Is that correct?
Yeah, I mean, first, I assume I'll have end up having a question for them, but I guess to start, what was the, we talked about impact now turning to Turning Point. What were some of the concerns? Was it group? Was it individual? Was it location?
Sure. Can I, before I address your questions, I've kept David and Jennifer as panelists, but should I release them, or will we have additional? Maybe I could.
I don't have any other questions for Skylard or Metro.
Yeah, why don't you release them as panelists? But if I know we've already taken up so much of your time, but if it's possible to stay, we would welcome, just in case.
Of course.
Yeah, I would definitely hope they would stay, but I don't have any immediate questions at this point.
Perfect.
Okay.
Thank you.
Okay, I'm sorry. Give me just one minute here. Okay, I'm Jennifer and David. I'm removing you guys. No, I don't want to do that. I don't know how to. I just gave them permission to talk, Sarah, but for some reason they're showing up now as panelists, so I don't know how to drop you guys back in.
We might have to. We might need you to log back in.
Sorry. Log out and log back in.
So if we delete you, it is unintentional, but it says remove. It doesn't say unpromote. So I'm not quite sure what happened here. So we apologize.
I think I know. I think it said join the panel and unmute, and I think I clicked on join the panel instead of just unmute. I think that's what happened.
No worries. But please come back on, okay? I'm going to hit remove, unfortunately.
Will do. Thank you. Thank you so much.
Thank you.
I'll do the same thing for you, David. And again, so yeah.
Okay. And then I can address your inquiry, Councilmember Burns. It was for Turning Point. Turning Point. Did have group sessions. But Turning Point was not able to offer services off-site. So they can provide telehealth services, virtual services, and they can provide services at their office, but not at unique locations throughout the community.
And that's office in Skokie, right?
Correct.
And then I always get Turning Point and Trilogy mixed up, but who's doing the
living
The
room.
Yeah.
center, the living room?
The living room, yeah,
Turning Point.
Turning Point. So will they be able to see clients there or no?
No,
Okay.
no, that is a totally separate program. That would not be appropriate.
So they would still have to go to find a way to get to Skokie.
Correct. And we're, not there's a period of time still till the living room be built out anyway, but that is a totally
Right,
separate facility for a different purpose.
Okay.
And now that you asked that question, Councilmember Burns, I remember this conversation, and it was that the Evanston community members would need to go to Skokie for the Evanston program, and that was the concern.
Yeah.
And Turning Point is already seeing different Evanston residents, or a lot of Evanston residents. Do we know when they're going to be up and running at the living room? Do we have an idea, a season?
The build out is still there's some work being done. As everybody knows, it's quite difficult to get any kind of construction work done, and costs are changing. And so it will be probably at least a year before that is completed.
Can we have someone from Turning Point on? I just wanted to
Please. Yeah.
For them to speak to the not provide on-site therapy or support.
Hang on. Yeah, I see a hand.
I was under the impression that they could come to Evanston at one point, but I'm not sure if that's correct. I'm not sure if my recollection is correct.
Okay, we have
Hi.
Tina Cortez. Sorry.
Oh, sorry. Hi. Yes, just wanted to clarify regarding the groups. We certainly have the capacity to provide groups other than at our current at our base location in Skokie. We've done that in the past when we've had requests, and we've gone to schools, we've gone to other places. We just don't happen to have a brick and mortar location in Evanston where we are currently providing groups, but it is certainly not something we cannot do. It's just not our current situation right now.
And the providers we recommended approval, they all are located in Evanston and have Evanston offices. Right.
So I believe
I apologize. Pardon?
Out of the
Jocelyn
three-
is not located in Evanston, but
Okay.
Jocelyn is.
But similar to what Tina just said, they can do that as well. They can find space in Evanston and hold
Yes, and they
groups.
proposed that in their application. So, yes.
Okay.
Mhm.
And Turning Point did not propose that in the application. Is that what I'm hearing?
Correct.
Correct.
Okay. Okay. So, and then I heard Tina, you said group, like offsite. If we find a space, offsite group counseling, individual as well, or only group?
We've certainly done group. We could look at individual. We don't have a brick and mortar location where we could do that right now in Evanston. But we have done individual offsite as well.
You've done individual offsite. Okay.
Mhm.
Okay. And Jocelyn said that as well in their application, that they could do offsite individual.
Yes.
Okay. And then in Turning Point, same questions about kind of access to different languages and the identifying as Black male, black female as well. Where are your therapists?
So we have 11 clinicians who identify as BIPOC, 2 of whom are oncoming crisis directors who are both African-American females. We do have 1 Black male on staff and 1 Black female currently on staff. And then as far as different languages spoken, we have 2 clinicians who can provide services in Spanish.
Tina, I just want to, I think you meant this, but I just want to really make sure I'm clear. When you say you said on staff, you meant on staff as therapist or clinician?
Correct. Everyone I'm talking about are
Perfect.
clinicians who provide clinical services. I'm not referencing our support staff.
Perfect. I just wanted to make sure I followed appropriately.
And so also, we have hands up. We got another. Oh no, that's Tina. I'm sorry.
Sorry, I put my hand
No,
down.
you're good. No, you're good. You're good. So, I guess my after hearing all of this, I think what's really important, it seems like we have a lot of providers that accommodate Spanish speakers.
Mhm.
I really want to make sure that we have, and there's many different groups that have unique challenges that need to be addressed. As someone who represents the Fifth Ward, who is she has a strong kind of historical African American community, as well as a kind of growing Latinx community. I'm really concerned about those two groups, and it seems like we've been able to identify providers that can support native Spanish speakers. It's really important to me that the providers have therapists who identify as Black male, Black female, and so between Jocelyn, Metropolitan, it seems like Metropolitan does not. Skylight does. I think I heard Black male and Black female. I might be wrong on that, but I think that's what I heard.
I think that's what I heard too.
And then if David can get us a little thumbs up in the if that's true, Black male and Black female. I think that's what I heard from Skylight. And then where is Jocelyn at on that? Do we need to pull them in to know? Because I know in the app they may just say BIPOC, but I would love to know if they have therapists who identify as Black male, Black female.
Pulling in Susan Resco from Jocelyn.
Hi,
Oh.
good evening. So yes,
Good
we
evening.
have several, can you hear me?
Yes, thank
Okay.
you.
We do have several Black male, Black female therapists, over 24 therapists that speak Spanish, as well as therapists who speak French, several Indian dialects, Urdu, Pujami, Polish, Mandarin. In addition, we have a BIPOC scholarship program for our staff who identify as people of color and want to receive their master's. We have a scholarship program for them to pay 100% of their tuition if they agree to work for Jocelyn for 4 years afterwards. We are a Medicaid provider, and so that the clients would stay with their therapist if they need to stay on after 6 to 8 sessions.
Okay. And I think I heard this right, that Impact, and I don't have any further questions. So Jocelyn, thank you for that. And that sounds wonderful. I think where I'm at is if Impact is both located, Impact has offices in an office in Evanston, right? I don't know. I would be willing to add Impact if I heard this correctly, that they have an office in Evanston and they have therapists who identify as Black female. I think I certainly would feel comfortable to adding them to the list to recommend for. And we work through them for individual counseling. I understand they don't provide group, but some of the other providers do. And I think the combination of local and having diverse therapists is important, because knowing the referring agencies, at least a few of them, or if not all of them, they are working, with the African American population. And I think it's important that we provide as much access as possible. And if they are local and have diverse therapists, I certainly would not mind adding them to the list of recommended providers.
Yes, Jessica.
Thank you so much. So if I could also say, Skylight is able to take on 100 new clients. Jocelyn could take on 400. And Metropolitan also was able to take on quite a number. Impact identified the capacity to take 20 to 30 new participants. So I applaud the idea of adding impact, but just in terms of agency capacity and also like staff capacity to manage referrals.
I
I
think
would,
four would be too much. Because I know we started off at, I believe, 11. And so I understand the staff capacity issue, which I've been very mindful of that. But, you know, you don't think we could push to 4? And I think the fact that it's only 20 hopefully should help that, you know, we know what the limit is for them. And so they would not take up as much of the funding that we're providing. So we could use that to support the other three groups or providers.
you know, I'm open to whatever the committee decides, but because this is a new program and we're just working out many components, my thought was to start the referral process, especially for individual, with 1 or 2 providers who could take on more participants potentially, rather than more providers who I would be referring a number of participants.
I guess if we can have impact back on quickly, because in addition to local, you know, diverse therapists, especially those identifying as Black female, also the Medicaid, I think they take Medicaid, which is important. And so if there's some ability, that's why I would love to talk to them again, to if they feel like that capacity will increase over time. I think I still would like to start with them, include them in the list of recommended providers, especially if they feel like their capacity will improve. Yeah, go ahead, Samantha. I'm sorry.
No, if we can promote them, and I will say, if I recall, and as we're promoting them, they'll be able to correct me if I'm wrong. I must say, the one thing I was most impressed about with Impact was the number of average sessions they needed before they transitioned a member over to Medicaid, and I believe it was 1 or 2. And so to your point, Councilmember Burns, of because both capacity, but also sort of their deep commitment to Medicaid, I do think potentially they would not use many of the resources of the program because they have that process in flight. So they can correct me if I'm wrong, but I do recall being very impressed by that number. I have both Kathy and Sarah, but Sarah, you just lowered your hand, so perhaps that was old. Okay, you're good. All right. Kathy.
I'm good too. I'm good too. I'm going to listen to what Impact says, but actually I take that back. I apologize. As far as this being these agencies will be queued up and rotated in some sort of form and fashion, correct? Regarding referrals to them?
So it wasn't so much a rotating process. I think my next steps are to now, once the providers are approved, I think it warrants ongoing conversations between the mental health providers and our referring partners to see who would be a best fit
for the partners.
Correct. Correct.
Okay.
Okay. But it's not as though I have a referral process in my head where, you know, Jocelyn gets one and then Impact gets another, or yeah.
Right. Okay. I was just trying to be clear with that and understand that they would be connected to a referral system regarding local need from those who are already working in the process with the patients. This is for more intensive therapy or extensive therapy for the individual and the family or a group unit. Okay.
If I could also say, if we bring the case managers into this process, it would also give the case managers the opportunity to work with participants so that, you know, participants have that level of choice.
Agreed. Thank you.
Thank you.
Sarah.
Thank you. I do want to remind everybody that one of the things we said is the matching process is a totally new thing. And one of the challenges is we have a lot of organizations to match up with. It may complicate it and not, it may make it more difficult to work out a system. And that was one of the reasons for looking at providers that really had a broad capability. And because, again, this is hard to predict, but not everybody is going to have the same capacity to take new clients at any given point. And we did say that we would obviously take a look at, we agreed that 6 months was really the first, we had to give a little bit of time. So regardless of whether we have 3 or 4, I think it's important to realize that we have never expected that we would only stay with, that there may very well be needs that we find that we aren't aware of, and that we may need to add different practitioners to beef up certain capacities or to find capacities that we don't currently have.
Thank you.
Yeah, I just think it's important to have a local therapist, Black therapists that have the ability to sustain their work with someone beyond the grant funding. And I think including Impact gives us that, gives us a local agency that can do that. Jocelyn, in my understanding, is it does not have an office locally. They do not have an office locally, so they don't check the local box for this particular scenario that I'm providing. And I think what I heard from Metropolitan is they don't have any Black therapists at all. And then Skylight again does not take Medicaid. So there's some concern about someone starting off with a therapist and then having to and then being referred to an intern or someone else. And so I'm saying with Impact, we can get Black, those who identify as Black and female at a local agency that also take Medicaid, so we can, if someone is introduced to a therapist that they like and they get along with, they can more likely continue on with that person beyond the grant funding. So again, I think adding Impact really does make sense.
Yeah, not debating that, but Jocelyn would be seeing clients in Evanston. They are not expecting them to go to their office because.
No, I know.
Yeah.
I just think
Okay,
just
wanna
having
make
that
sure
local
that we didn't
presence,
have that misunderstanding.
it eliminates the logistical issues of trying to find space, and they may have a relationship with someone that just gives them a space, like this is your space, Jocelyn. I don't know how all that works, but even priorities change and space availability changes. I think having that local office is important, especially for a group that most of these referring agencies are serving, large parts of the I think who they're serving is African Americans. I can think about Family Focus and Moran Center and others. So I think this makes sense.
Okay, Chris Nober from Impact has his hand raised virtually. Can I promote him?
Yeah, if he can be promoted. Yeah.
Chris?
Hello.
Can everyone hear me?
Yes.
Great. Thanks for this great discussion, and I just wanted to address a few of the points that people were asking about Impact. So in terms of capacity, we did propose that that 20 to 30 number. That's a caseload of a therapist. However, we've increased capacity in programs where there has been a need pretty successfully over the years. But we've increased our service population by like 20% every year by expanding our services. We and could do that if there was a need. Just this being a new program, we weren't really sure what the need would be. In terms of you brought up the point about a few sessions of coverage before we would get someone on Medicaid, and then could provide then Medicaid would then be the payer for these individuals. So we would no longer be requiring the support service funding. That's correct. Our staff well-versed in that program. And because we are very committed to making sure anyone that qualifies for that resource, which is really the population that we serve and specialize in, are individuals who would qualify for Medicaid. We are very committed to getting people that resource, not only to continue to get our services for as long as they need them, but also because of all the other services that it would allow them to utilize. I mean, most importantly, primary care and, getting medical services that maybe they're not getting if they're not covered by insurance yet. And in terms of connection to the community, yeah, we have been here for over 30 years, providing permanent supportive housing and providing supports to individuals in supportive housing. We work with a lot of different agencies in the Evanston community, including some of the ones that are doing case management now and looking to refer to services. We, just last year, we received 18 referrals from Connections and provided 342 hours of services to those individuals, and look to continue working with them as well. So in that case, we already have the existing relationship to continue to collaborate and provide wraparound services if we are the ones providing the therapeutic care. Any other questions? Anything I missed?
And Chris, just a quick question. Do you, the therapists that you have that identify as, Black male, Black female, do they have capacity currently? Because it's one thing it's one thing for them to be employed at the agency. It's another to know whether or not they have capacity and if they're available to take on new participants.
Yes, they do currently have capacity, and they would be part of the service provision team for this grant.
Okay.
Or for this funding, not grant, sorry.
Yeah, so that's all I have. Again, I'm comfortable with the three that we recommended, but I think a better balanced recommendation would be to add impact. And so I'll just for the sake of time, and I appreciate everybody for hanging on in there, but I'll make that motion.
Perfect.
To add impact behavioral. What's the whole name? Y'all know which one I'm talking about. Impact behavioral health
partners.
Is it? Oh, it's partners. Okay. Impact behavioral partners as the fourth kind of recommended group for grant funding.
For individual therapy, right?
For individual, yeah.
All right. Do we have a second on the motion?
Second.
All right. Jessica, can you call the roll, please?
Yes.
Ken, your first vote.
Yeah.
All right now.
All right, well, Ken Rowling.
Yes.
Great. Kathy Hayes.
Yes.
Great. Cheryl Fry.
Yes.
Great. Councilmember Burns.
Yes.
Great. And Councilmember Reed.
Councilmember Reed, you might still be muted. Councilmember Burns, could you maybe text Councilmember Reed?
We can move forward. I think we need, he's our quorum. Is that?
Yeah.
All right, hold on.
Sorry.
Although technically, once we have a quorum, as long as we have a vote.
And it's the majority voting.
We are, I think we're fine.
Right.
Okay.
So we would just have him as abstaining from this vote.
Right.
Okay.
Or just is not voting. Yes.
Not
So
voting.
that's-
Not voting. Yeah.
Perfect. Thank you for that. Just had to adjust the notes.
All right. Okay.
And then one final just general question for staff. Undocumented who do not have Medicaid or are eligible for Medicaid, or are they eligible for Medicaid? Samantha,
Oh,
it
I
seems
can
like you're
answer this.
lighted
I'm
up to
so
speak to it.
excited.
Yeah, thank you.
I'm so excited. So we in Illinois cover all children,
Yes,
regardless of documentation status. We also
absolutely.
now cover 42 and up. So there is a unique gap from 19 to 42. I do believe that folks are working to close that gap. And I anticipate in the next few years that gap will not exist. But so we cover children regardless and 42 and up, which is, and for full Medicaid. We also cover, regardless of age or documentation status, family planning. And we have certain cancer screening and other programs that are sort of that administered by our Medicaid agency, but are sort of like a Medicaid lookalike program, if you will, for certain limited benefits. Illinois is
Prevention
a
based, right?
welcoming state. We
Nice.
support our neighbors.
Nice.
Thank you for that education, Chair. I appreciate it. That's good news.
It really is. And I can send to Jessica to just include in the minutes, their HFS has a nice little application landing page for that benefit program that I think we could all benefit from just sort of having. So I'll send that over as well. It is a wonderful, wonderful benefit. All right. Anytime you get me talking about Medicaid, I get excited, but we are now moving on to agenda item B. A 5B, which is our FY 2023 case management and safety net application hearings, to remind everybody how we try to do things. And I will say we are at the hour of 8:53, an hour and 53 minutes into this meeting. How we normally do things is we hear from the various applicants. Then in the next hearing, we vote. So this is just, this is not voting on this, and we have public comment again, and then we'll have a second hearing or committee where we will further discuss. We'll have again 2 times of public comment, and we'll take a vote in that secondary meeting. But we're not voting on these applications this evening. Did I get that all right, Jessica? Great.
So the second meeting is in January?
Correct.
Okay, good. Thank you.
That way you have more time.
Oh, yeah.
The
Yep,
idea
I'm with you.
is just the beginning. All right. Let's go ahead and
Okay, so we have 18 applications. There are a number of agencies that submitted 2 applications. And I would like to go in alphabetical order. I promise agencies next year I'll go in reverse alpha order because, you know, the same agencies kind of go first and go last. But just some housekeeping, please keep the presentation short. We're going for 5 minutes with time for committee members to ask any questions. And I can like raise my hand or start the wrap up music. All right, so first I would like to invite Books and Breakfast. And so if you could please raise your hand, it will make it easier for me to find you. I know that I saw agency representatives here earlier. All right. Oh, Kim.
Hi, everyone. Can you hear me okay?
we can.
Great. Good evening, everyone. Thank you so much to this committee for your time tonight and for your partnership the last number of years. My name is Kim Hammock. I am the Executive Director of Books and Breakfast. If you would like to reach me after this meeting, my phone number is 847-477-0716. My email is kimh@booksbreakfast.org. And our mailing address is 419 Greenwood Street in Evanston, 60201. For more information about us, you can find us on our website at www.booksbreakfast.org. And I'm really grateful to be with you all tonight. Wanted to start to give you a short introduction to Books and Breakfast and then tell you a little bit about our application. Books and Breakfast is an Evanston-based nonprofit. Our mission is to advance educational equity in partnership with District 65. So really thinking about educational justice and equity in Evanston schools, serving kindergarten through 8th grade students. Our first strategy to that end is we provide a daily morning program in Evanston schools where students can have a healthy meal. They have access to one-on-one tutoring. And the hope is that every day in every way, students are experiencing a place where they feel cared for, seen, valued, and empowered as learners. Our other strategies are we do offer summer programming with a reading support focus, and our staff spend hours and hours working to build relationships with parents and families so that parents can feel connected to and advocated for within their local schools and connected to additional Evanston resources if social service needs arise or crises arise. Last year, we were providing programming in person at 6 schools, working with 180 students and working with hundreds of volunteers coming from places all out through Evanston's community. Our application, what you'll see in there is that we have desire and intention to grow, to be able to serve more students in more schools. And we're excited about those next steps. Just to clarify what puts us in the in the safety net services category, I mentioned that our mission is educational equity, and underneath that is a real acknowledgement of the historical inequities and disparities within that system in Evanston. So our goal is to disrupt systemic racism in our school and in those systems, and then to address resource gaps for students who qualify for free and reduced lunch. Every student in Books and Breakfast is recommended to us by their classroom teacher and their principals as needing additional support. So in that way, we're very strategic and targeted. We give priority to students of color. We give priority to students who qualify for free and reduced lunch. Last year, 97% of our students identified as students of color, and 93% of our students qualified for free and reduced lunch. 100% of our students are Evanston residents. We work to build a community for families and for kids that brings in resources and connection that should stabilize a kid's experience in school and should really be an anchor for families, bringing in additional resources that help bring greater success in learning. In terms of measurement, does this work? What do we know? We are really grateful to continue to get requests from school leaders to continue to expand the program. And when we look at our end of year surveys from just last year, 88% of our students showed increased homework completion, 92% showed increase in their confidence as learners, and 94% showed an increase as verified by teachers in their social emotional readiness for the classroom in the morning. Also, 94% of our parents said that they feel more connected to their students' learning experiences and to additional resources within the Evanston community because of B&B. And last summer, we were able to pilot a new reading tutoring program, an intensive reading support program, where 6 weeks worth of tutoring, our students on average gained 2/3 of a grade level and their reading levels. And we are very excited to work on increasing that and growing that program next year. What you'll see in our application is that we want to grow. We want to make sure that we can increase the number of students at our current sites and add additional sites, 1 or 2 additional sites in person this year. And we're also working to stabilize and to really deepen our infrastructure as a younger organization, making sure that we can hire and retain the right staff and making sure that we can provide high quality care and services for the long haul. Last thing I would say is that we're built to bring in the Evanston community around our schools and around our students with this goal that every student should be able to thrive in Evanston schools. So we're grateful to partner with Northwestern parents, families, educators, and we're also just really grateful that the city of Evanston is a part of that work, really putting into action our value around our children and making sure that we have fair and just experiences in our schools. So I'm happy to answer any questions, but we really appreciate your consideration.
Thank you so much, Kim. That was really thorough in a very short period of time and incredibly impressive. So if everyone can follow Kim's lead, we will be very happy. I want to ask if there are any questions from the committee members, and I do. Jessica, while we go through each presentation, we currently fund books and breakfast in the safety net pool. Is that correct?
That is correct. And their request is flat.
Perfect. Can we just be, as we're sort of like, can we just sort of like kick off before each presentation that we just say we're currently funding them, the request is flat, or just to kind of keep our, that would be helpful for me.
Sure. You know what? I can share my screen, and we do. I have a spreadsheet for that. If that
I'm pivoting through a million windows, and
I'm just thinking, actually, Jessica, it might be better just to read it verbally, because I think even just the getting back and forth.
Sure, that's fair. Happy to
just
do
a
that.
thought, because I don't think everybody's going to be reading it off the screen.
Perfect. Sure. Any questions for Kim?
Hi, Kim. This is Kathy Hayes. How are you? Thank you so much for that presentation. I do appreciate it. I also appreciate the work that you all do. I would like to talk about some of your staffing,
Sure.
so that you could articulate some of the diversity that is reported here in your staffing for me, pretty please.
Yeah, absolutely. We have 11 staff members, and 9 out of 11 of those staff members identify as BIPOC. We have 1 native Spanish speaker and 1 native Urdu speaker on our team as well.
Which is phenomenal. I've been by the agency. I've seen families come in and out, which is a great sight to see. One last little insignificant question, probably. You guys are saying something about the ADA, your door is an ADA coded, and are you guys doing anything to address that?
You know, we every program that we offer happens in District 65 buildings. So in terms of compliance around that, we are at the mercy of District 65. So I don't completely know the answer to your question.
No problem. I was just curious. I saw it and didn't know. And as you said, Chairman, this is a flat request. But is there still issues? I know that there's no busing early in the morning, but you guys have worked out how to get students to the schools for early morning.
Thank you for that question. It's an excellent question. I think many of the schools that we operate in, our families generally are dependent upon busing because they're leaving their neighborhood, especially students and families in the 5th ward. So busing continues and transportation continues to be a barrier that we would like to see new ways to get around. I think the good news for us is that families who usually require the bus because of the 9 a.m. start, because we begin at 8 a.m., the majority of our families are able to get their kids to school at that hour because it is more, it just coordinates more with schedules in terms of getting to work. So for the most part, the majority of students, the vast majority of students that have been recommended to us have not been kept out of the program because of transportation, but that is a very clear equity issue for District 65 that has not been remedied. And we know it would increase the number of students who would have access. So that is something we're continuing to work on.
Amazing. And you want to increase the student involvement up to, I'm sorry, I too am flipping through things.
From 180 students last year to over 225 is our intention for this year, and to add 1 or 2 new school sites in person as well.
Amazing. Thank you very much. That's the end of my questions.
Thank you.
Thank you. And those were wonderful questions, Kathy, definitely not insignificant. I'm gonna thank you, Kim, for sticking with us. Ken, did you have any questions?
I thought that I thought you said that the request is flat. It looks to me from the budget sheet, it's an increase for 2023.
I apologize. I was going to mention that it's a $20,000 increase from 45,000 to 65,000.
Okay.
I wasn't going to let you go, Kim, without pointing that out, but
thank you, Jessica. I appreciate it.
And actually I have a follow-up sort of to that, and it may align with it. It seems like in the app I saw that there was a decision that the organization needed to go from staff being part-time to full-time.
Correct.
And is that why? Is that why you've increased the ask, is to really try to support the insurance that you're now offering and the increased salaries that you'll have to provide going from part-time to full-time?
That is exactly it. So I appreciate that question. We are, for the first time ever, we're almost 10 years old. And so this year our budget is just over $1 million for the first time. And I think as a younger organization, we've been working towards a really healthy long-term infrastructure. And it just became really clear last year that to be able to hire and retain the right people, the depth of skill set that we're looking for, we need to move our positions from part-time to full-time. And that is about long-term sustainability and really holding to the integrity of care. So yes, that is exactly why there's a jump in our overall budget and a jump in our request to help us build and invest in that way, because we feel like the intervention and the work we're doing is the right work. But to do it well over time, we're going to need to deepen our investment.
That's all, Chair. Thank you.
Yeah, thank you.
Thank you. All
And I'm
right.
sorry, also part of that is growth too, as well, not just in terms of the staffing changes, but also to be able to reach more students and more school sites. We want to grow, and we would love your partnership in making that possible.
Thank you so much, Kim. All right, we'll go to our next group.
Great. So next up, we've got CNE and Deepa. CNE has two applications. One is for a program, the Learning Together program, which was funded in prior years. The other application is for a new program. CNE will have two speakers. I'm going to invite Deepa to talk about the Learning Together program, which received $63,400 in 2021, and some of those funds carried over into 2022. They are requesting an increase of they're requesting $70,000 total for program year 2023. Nope. And now my mouse just has to work with me a little bit to.
Here we go. Deepa, go right ahead and kick us off.
Okay, can you guys hear me?
We can.
Okay, great. Good evening, everyone. My name is Deepa Mehta. I'm the Director of Programs at Child Care Network of Evanston. My phone number is 847-475-2661. If you want to learn a little bit more about CNE, our website is www.childcarenetworkofevanston.org. And our address is 1335 Dodge Avenue in Evanston. So CNE's Learning Together program has been active for over 20 years, serving early childhood providers in Evanston. We have made significant changes to the program as of 2021 to reach more children and centers in our community. However, our original model continues at Puerta Abierta Preschool, which is located in Evanston. Our Learning Together consultants support this center on a weekly basis. That team consists of a mental health consultant, 2 speech and language pathologists, and 1 early childhood specialist. And they are currently supporting 10 children at this particular site. We have added the consultative model approach that is a referral-based and has potential to reach many more centers and children and families. Over the summer of 2022, the Learning Together program reached out to 31 Evanston-based centers to share what the Learning Together program has to offer. Since implementing this new model, we are now working with and supporting 9 centers and 22 children, which is in addition to the weekly visits we are doing at Puerta Abierta. Once we receive a referral for consultative services from local Evanston childcare centers, we review it to gauge the need, share it with the consultants, then the lead consultant reaches out to the center and the parent to learn more about the child and the concerns. Parents provide written permission by signing a consent form. Classroom observations are conducted and information about the observations are shared with the teachers along with techniques they can use in the classroom to best support the child. The consultants also reach out to parents to discuss the observation and what the plan will be moving forward. Follow-up meetings with the teachers occur to ensure that the techniques are working. New techniques are also shared if needed. This model is implemented for 2 to 4 weeks. After this time, centers are able to reach out to consultants as needed for additional support. If a child is being referred for early intervention services, the consultants will see this process through. Given the structural changes to the program and giving access to these services to so many programs, we have seen a higher demand and need. As a result, we are serving more children and families, and we are providing more support to the early childhood community and workforce. Currently, we are serving over 50 teachers and administrators. The centers that are referring to the Learning Together program are all located in Evanston, except for one. This center is included because it serves Evanston families. Currently, we are serving 71% Evanston families, and out of all of the families served, Evanston and non-Evanston families, 58% reported they are between 30 to 50% of the median income. Although we don't collect information on what specific barriers families may face, costs would be a factor. If families were to receive similar services elsewhere, if families were to receive these services elsewhere, the Learning Together program provides free services where we are addressing needs of children that need support right away. Once we receive a referral, the center and parent is contacted within 24 to 48 hours. The techniques that the consultants are providing or teaching teachers are not only meant to improve outcomes for children, but also to ensure sustainability of the changes the teachers are asked to make that will support future children that enter the classrooms we support. Successful teachers feel good at what they do and stay longer in their positions, which help solve the staff shortage problem in Evanston. Thank you so much for this opportunity. And if you all have any questions, I'm happy to answer them.
Thank you so much, Deepa. It was really helpful.
Mm-hmm.
Any questions from committee members? I have one, and I think this is assumed, but I just want to confirm.
Sure.
A member or a child's referred for EI, there's an EI evaluation. That would all be separate funding. That's just traditional EI funding, correct?
Correct. We just, our consultants would just see the process through with the family and the center staff that are involved.
Perfect. And that's actually wonderful because it can feel kind of.
It's overwhelming. Yes.
Yes, absolutely. Perfect.
Yeah, perfect.
Kathy, any?
No. I enjoyed reading the application. And I don't have any questions. I'm sorry.
No, don't apologize. I think that really demonstrates the depth of the application and that your presentation, Deepa. Thank you so much.
Thank you.
All right, and we have another.
Yes, so now I'm inviting Caroline from CNE to talk about their new application for mental health services.
Hi, good evening. I'm Carolyn Muskowski. I hope you all can hear me, and I assume you'll let me know if you can't. I'm the programs manager at Child Care Network of Evanston. Same information as Deepa, but I'll go ahead and repeat it for you quickly. My phone number is 847-475-2661. We're at childcarenetworkofevanston.org and at 1335 Dodge in Evanston. I'm here tonight to share information about our mental health services for Evanston Children and Families program. We have been providing free mental health services to families with young children. We serve preschool families and younger for several years under a variety of funding sources. Our program started with just partnering with a small number of Evanston-based early learning programs to receive referrals from their families. But this past year, we were able to expand to really include all early learning programs in Evanston. So all of the children and families that are referred to our program come from one of these early learning programs, and they're connected through CNE to a licensed therapist who provides 6 to 12 sessions of therapy at no cost at all to the family. Our program currently is funded by a grant out of Northwestern's Racial Equity Program, and that grant does expire on December 31st. Hence why we're here today talking to you all about a potential new source of funding for this same program. So during the course of this one-year grant with Northwestern, we've provided over 300 therapy sessions to over 50 families. 83% of the children and families who received services in the last year identify as families of color, and 88% reported having a household income of less than $40,000. So the goal of our program is really to intervene when a family is in crisis, experiencing trauma, or has experienced trauma and could benefit from therapy services to help stabilize the family. Our goal is really to provide an immediate referral to a licensed therapist. And historically, we've only had one short time where we had a wait list for families to be, to get that immediate connection. We really aim to reach families that may not be able to afford therapy on their own, or perhaps even more importantly, may be reluctant to access therapy on their own. We find that, all our referrals are coming from the family's trusted connection to their early learning provider. So it can help ease the decision to seek services either for their child, for their family, or for themselves. And we really hope to just introduce the idea of accessing mental health services early in the lifetime of the family, so that that family is more likely to continue to access these services as they grow and face, unfortunately, probably new challenges. I just want to conclude by saying that a recent community organizing and family issues meeting, which is COFI, they represent Evanston families. The top need identified by those families was access to mental health services for children and families. Fortunately, our organization, representatives from the Community Foundation, City of Evanston staff, and public officials were all there to hear this. And our program really is here to provide those needed services. So that's what I wanted to share with you all. I'm happy to answer any questions you have.
I have a few. I'll kick us off. And in part, because this is going to be very similar to what we asked of our previous mental health applicants. And I'll just list a few. Can you walk through your staff of color? Specifically, I think Councilmember Burns, do you have Black men therapists or Black women therapists, languages spoken? And then also, and I looked through the application, and if I missed it, I apologize. I understood that Northwestern was ending their funding. You're asking for, I believe, $50,000 for this program. I hope I'm not getting the numbers mixed up. Can you outline what was Northwestern's funding? Was it the 50,000?
Yes. I think our funding from Northwestern was slightly above that. I apologize. I'm drawing a blank on the exact dollar amount, and I will try to look that up while I'm talking with you. It was a very similar amount, and I do want to just elaborate to say that Northwestern chose to not refund any of their current recipients. Yep. So that was just the way they were operating for that grant cycle.
Thank you for pointing that out, because I knew that, and I knew that them not funding you didn't mean anything negative. It was a unique choice that the university made, and so yes, I apologize. I knew that, and I should have made it very clear that it was not a reflection on your performance.
Thank you. And yes, I did get the information. It was $75,000 was the grant through Northwestern. But that involved some additional things like training. And, obviously the partnership was also with the Family Institute. So there was a wider pool of therapists that we were working with. We had a unique arrangement where CNE has a pool of therapists that we refer to separately, and then we were referring also to the Family Institute. So of our own therapists, we do not have any African-American therapists on staff. That's definitely been, it's one of our goals for this program. When this program started, our focus in kind of gathering therapists to work with the program was really to focus on those who had early childhood experience. So that was really kind of our primary selection criteria. And we've realized, particularly over the last year, we were able to track some additional demographic data that we really need to find more therapists who can match the clients that we're seeing. And obviously I reported, that we're seeing a large number of families of color. So that is one of our goals. We do have a Spanish speaking therapist, but otherwise at the moment, our therapists are all female, and I believe predominantly Caucasian.
Okay. Do you accept Medicaid?
So this is one of those unique things where we really operate as a referral agency for this program, and we're sending these clients to basically private practice therapists. So each of those therapists has their own arrangement of payment for their own clients. And for these clients, obviously they're receiving funding through us. To the best of my knowledge, none of our therapists accept Medicaid. It's certainly something I could look into, but again, not in my awareness, none of them accept Medicaid.
Yeah, if they're in private practice, I would
Be unlikely.
wonderful,
Yeah.
unlikely,
Yeah,
even those that serve children.
right.
All right. Any other questions? I think I asked all the ones we've ran through previously for mental health.
Yeah, Chair, I just have one question for staff. Are we continuing, I guess, to receive requests for mental health services through Safety Net, or was the plan to have them all go through the support services program instead, or is that a side thing, and that it is more than appropriate to also request grant support for mental health services from the Safety Net?
So that is a good question. The mental health provider application was opened as a standalone program, and CNE and I have been in contact because they do work with a lot of families, and they do have a referral process. They also work with that unique population of younger children. And mental health services, there has been some discussion about whether or not we see them as Safety Net. Sarah, did you have anything that you wanted to add?
And I think go ahead, Sarah, sorry.
I just wanted to say there's nothing that would preclude mental health services from being a Safety Net service. It depends on how it's delivered. The funding, the fee-for-services funding that we just discussed is really designed as a support services for the people in case management. So it's not a one or the other, but there are the criteria for Safety Net services of being something that people can get into relatively quickly into services to deal with an immediate need, and all of those other criteria that Jessica can probably give you more accurately than I can.
If I could also just say, staff did work with CNE. I've worked with CNE, and because their mental health program reaches, sort of all child care providers in Evanston, and has the opportunity to reach those families, it was sort of a unique program, and would potentially reach a population that we might not serve, and it's an established program. So,
and the last piece I think was the idea that the Northwestern funding, there are families in this program now, Carolyn, right, that are funded by that safety net, so to speak, would cease to exist without additional funding. Am I understanding that correctly?
Yes, that is correct. We have a number of families who are still continuing to receive services, and that's definitely been a challenge as the funding has wound down, is to try and transition those families carefully.
And I do want to state that because these are young children who may not have the families and other, they may not be in robust case management, that may not be of need, the idea of catching this really rather important need for very young children is really would qualify as a safety net. I didn't do a very good job of explaining the safety net rationale there, so sorry about that.
No, I think one of the main reasons I brought it up was just to communicate to some of the other providers who apply for the support services grant that depending on what services they provide, that we're encouraging them to also apply for under the social safety net or other programs that they may qualify for. So, but that's all. Thank you.
Yeah, thank you. And I think that great call out. Absolutely great call out, Councilmember Burns. Other questions? All right, I believe Connections for the Homeless is next, if I have toggled to the right screen appropriately.
Yes, so Connections also has 2 applications. One is for existing the programs that have been funded in prior years. They're drop-in health services and outreach, and that is a level request of 150,000. And then they have a second application under the case management umbrella for their their youth program. That's a new request for 75,000. We have several members of Connection staff on the meeting. Oh, and Liz has her hand, so here we go.
Thanks, Jessica. You found me. I appreciate it. Hi, all. I'm Liz Novak from Connections for the Homeless. We do have some other folks online. I'm not exactly sure how that works, but I'm hoping if we get to Q&A and there's questions and there's other folks on the call that can answer them, maybe we can get those people over here too. Quick details about connecting with us. Our website is connecttohome.org for folks looking for more information. Phone number 847-475-7070. And our main address is 2121 Dewey Avenue in Evanston here in the 5th Ward. So thank you all for considering Connections' request to support our outreach drop-in health services. These are all safety net services for people who are unstably housed. And really, this is work that we're proud to do and really proud to do in partnership with the city, and that we've done for a number of years in partnership with the city to serve some of Evanston's most vulnerable citizens. Without a stable home, simple daily tasks like tending to personal hygiene, getting to appointments, taking medications, storing belongings, it's really impossible. And I think the words of our participants bring this to light. They shared, it takes a lot of time to survive. You'd be amazed, it takes 100 times longer to get anything done. Experiencing homelessness means simultaneously experiencing daily trauma. For 25 years, we've operated our outreach drop-in and health services where people who are experiencing homelessness can meet their most basic needs. They can heal, they can start to reclaim their lives. And we engage with more than 1,000 people a year across these programs. We estimate in 2023, about 65% of those will be from Evanston, though we were just looking at data earlier this week, and that percentage is actually much higher. And I thought maybe I could just share a quick client story to bring light as to what this work looks like. One of the Evanstonians we were able to serve this past year, Roger, we recently honored at an event, and he shared this. There are things a world of information and knowledge cannot prepare you for. I was a real estate broker. At one point, I never thought I'd be homeless. It's still hard to say it. I went through a traumatic life event. I'm not the best person in the world, and I'm not the nicest, but I care. I care a lot. I was in a traumatic situation, trying to find somebody who cared enough to help me cover the little things so when I could work on the bigger things inside of me that were broken. It means so much to be housed, to know that of all the things I have to worry about, of all the things I have to work on, where I'm going to lay my head at night is not one of them. Roger was a regular drop-in participant who worked with our staff and partnered with them for more than a year before we were able to help him connect to housing. And really, this is the impact of the safety net services we provide. We have a range of staff that support our drop-in outreach and health work. 2 outreach staff working across the streets of Evanston, 2 daily drop-in centers, one where I'm located right now at Dewey Avenue, the other one over at the Lake Street Church. These centers are both open Monday through Friday. Our health services are co-located here, and people can access all kinds of on-site services in sort of a one-stop shop, from showers and lunches to physical and behavioral health care and case management. These services are intentionally low barrier and open to all. People can engage in as often or as little as they choose. And this kind of work we do, where everyone has access to the most basic needs they need to live in our community, this is how we create a more equitable Evanston. There's a couple of improvements we're making to our work that we noted in our application. Victor, who's on this call with me, is a new manager of our outreach and drop-in programs and brings a wealth of experience to this work. We're in the process of hiring a new medical director who we hope will be a practicing physician who will oversee our registered nurse and our CNA and our behavioral health specialists. We have a partnership with the Alliance to End Homelessness in Suburban Cook County. They are the regional coordinating body for homeless service agencies like ours. And there's a new position that we've hired to help streamline the process for people getting connected to housing. So we stand at the ready to serve our neighbors who are experiencing homelessness and are delighted that the city is considering this request. So thank you, and happy to answer any questions you may have.
Thank you so much, Liz. I want to thank you for including the individual story. I think it really brings home sort of what we all do and what you guys do and how you support our neighbors. So thank you for starting with that. I think it's very helpful. Committee member questions.
With the situation of housing being so sparingly here in Evanston, I guess I'm asking, how do you see or project some of the issues with housing with your agency for so many? Because you said that there was an increase in many of the percentage of Evanstonians that you've helped here. And we have such housing instability issues coming. What do you see for the future, I guess, to addressing some of those issues? Or are you all working on any programs to address those issues of providing housing?
Thanks for uplifting that, Kathy. And I think we said this a few times in the application. There was questions along the lines of, what are the barriers you face? What are the barriers that people you serve face? And we know the biggest barrier is the lack of affordable homes for the people we serve. And so we take a multi-pronged approach to addressing this, right? So that these drop-in health and outreach services are one part of our work, but we also provide shelter and housing. We do that directly to have a path out of homelessness for people, but we don't have enough to meet the current need. Some of you might have heard of our work, Joining Forces for Affordable Housing. It's the advocacy arm of Connections, really addressing the root cause and what does that look like for our community to have that balance of affordable housing for people at all income levels, not just people experiencing homelessness, but we know to live in this community, it takes a certain income that can impact lots of different people. So appreciate you uplifting that, because it's the biggest barrier we see to the people we serve who might get stuck in these safety net services because they don't have a place they can afford.
And your services also address those with funding as well as without, and with those that do not have a social security number as well, correct? Thank you.
Thank you so much, Kathy. Any other questions? Liz, you did a wonderful job. Thank you. And I thank you, Connections, I think, for what you do in incredibly challenging circumstances. And we have now, actually, Liz, I'm going to ask you one more question. Are you the presenter for the youth program, or do we have that?
Yes, we should have done like C&E and changed it up a little bit, but you're going to hear from me again.
No worries. No, it's perfect. Go right ahead. I
All
just didn't
right.
want to.
Sure.
All in the wrong
Sorry,
person.
it's a lot of Liz in a row. So I won't reintroduce myself or share our agency information, but as Jessica said, prior to the last presentation, Connections submitted a request as part of the case management services, a $75,000 request to support our work providing case management to young people. So Connections Youth Program Services are for young people ages 18 to 26 who are homeless or at risk. And we provide a full spectrum to meet the needs of young people on their journey out of homelessness. So this includes both youth dedicated outreach, shelter, and housing. Our youth programs actually started about 7 years ago. You might have heard of a project called Our House. And at the time, there was a growing number of homeless youth in Evanston schools and really increasing community awareness about it. And that's when Our House was launched with a mission of ending youth homelessness in Evanston. There's no other program of its kind in our area. And there's a group of civic volunteers and philanthropists and faith communities and other nonprofits that came together to launch this effort by purchasing a 2-flat and then providing operating support to deliver housing and on-site services for young people experiencing homelessness in Evanston. It officially became a project of Connections in 2015. And from there, our youth programming has only grown. And so today, when we look at what we do for young people in that 18 to 26 population, we're providing that youth dedicated outreach, that youth dedicated shelter, and that youth dedicated housing. We're specifically seeking support for the case management services we provide to young people that's coupled with the housing. So we have about 30 to 35 units of youth dedicated short-term housing. Anywhere from 18 to 24 months, young people are in our housing programs on average. And we're expecting to serve about 45 young people in 2023 across these programs. Based on historical data, we're expecting about 70% to be Evanstonians, and we expect the majority of young people to identify as Black. With the city's support, another client story, we hope to serve young people like Adrian. Adrian's late teenage years were really difficult and stressful. When Adrian turned 18, his family said he could no longer live with him, and with no place to go and no other family to turn to, he actually began sleeping on the train, and when he could, doubling up with friends and even coworkers. He didn't share with anyone that he was experiencing homelessness. When he was finally able to open up and share about this, he was able to get connected to the support he needed and came to Connections and was connected to one of our youth housing programs. He got his own fully furnished apartment. He had robust case management support. He secured full-time employment and began taking courses at Oakton Community College. And with staff, Adrian's really working to save and make plans to cover his rent long-term and maintain that apartment he's got today. This is how we end youth homelessness. Last year, we served 40 young people and their children across the housing programs in particular, and we've had pretty strong success. Our youth programs team does incredible work. 87% of the young people who left exited for a housing solution aligned with their plan. So a young person that might be reunifying with friends and family, it might be moving into their own apartment, it might be moving into a residential program that's consistent with their goals. You will hear time and time again from our youth program team, they meet the young people where they're at and match the services to what young people say they want and need. And then after young people leave our programs, we really maintain commitment to providing what we call aftercare, which is continued case management support, so that if for whatever reason a young person hits a roadblock or they need some help or they're trying to need some transportation assistance, there is a person that they can go back to and talk to and maintain that connection. So the case management services are really a core part of how we do our work and how we do it well. And this is why we're asking for city support to make this happen. I just want to say that this youth programs work does not happen in isolation. There are other partners on this call tonight, and some of which we heard from earlier, that ending youth homelessness really takes all of us. And so I hesitate to name some names, but I'm going to say a few: the Moran Center, Youth Job Center, Kurt's Cafe, the Jocelyn Center, YOU. They have been critical partners in this effort to provide all of the services young people need to unlock their full potential. So again, if there's questions about our youth work and our case management services, happy to respond to those. And also if folks, we have some other staff on the call who are sort of our youth programs experts if they need to chime in too.
Thank you so much, Liz. I want to thank you again for including that member or client story. I think it really brings home why we're all here on this call. So thank you very much. And thank you for the work you do. Questions from the committee?
How long are the aftercare case management services? How long do you track the youth person for aftercare?
I can take this one. Can everyone hear me okay?
Yes,
sure
Jennifer.
can.
Hi, I'm Jen Foyer Crystal. I use she, her pronouns, and I'm the Senior Director of Housing and Youth Programs. I love that you asked this question because we're super proud of our aftercare services. We sometimes serve people that have a 3 at the front of their number. So we do have a few people that are hitting 30 and still need that support, and we have become their safe adult. So we continue to serve youth well into the end of their 20s. I've been working in youth programs for about 5 years, and there's people that we have been with that whole entire 5 years that went through our transitional living program, went into our Bridges, which is our aftercare housing program, then found apartments on their own, and they still come do their laundry at the house every week. So we really try to stay connected with youth. And we even have hired some of our youth. So that's the.
And you said hire your youth as peer counselors? Is that what I'm understanding you to say?
Jennifer, you might be on mute.
You're muted, Jennifer. Okay.
I'm sorry, I think I lost you for a minute. Did you ask a follow-up?
Yes, I did.
I don't know
You
what happened
hired
there.
the youth as peer counselors of some sort, or
We've
hired them?
actually, we've had youth from our youth services programs and participants in other programs as well that really became part of our pandemic workforce, and several have stayed on. So it's none of them have been peer positions. They've been positions like our program operations specialists that help around the shelter. We've had people go into different departments that they had a specialty in. And so we are always advertising our open positions to internally to our young people as well when we have a position that fits their skill set or something they want to try to go for.
Mhm.
Great questions again, Kathy. I guess, so you're currently providing these services. How are they being funded? And can you sort of talk about what the city funding would mean in terms of expanding capabilities?
Mm-hmm.
Sure. So there's a mix of, you'll see in the budget we submitted in the application, there's a mix of public funding from government sources and private funding. And so we're always, like other agencies, trying to fundraise to fully fund the positions that we have. So we're specifically looking for some support for 2 case management positions, one of which is providing the housing case management for young people that are in our programs, the other who is providing that aftercare housing. So as young people exit our programs but need ongoing support, and then the clinical supervisors and managers who are helping provide the support for the staff and frankly, direct service staff, sometimes direct services too, to the young people we serve.
Got it. Very, very helpful. Any other questions? My only comment is as somebody with a 3 in front of their age, I like to think that maybe that's still sometimes young.
So do I, honey. Me too.
All right. Let us go to our next group.
Mm-hmm.
Yes.
Unless there are other questions. I don't want to cut anybody off. No, great. Okay, perfect.
Okay. Our next application is Family Focus. They are a returning applicant, and the request is for level funding of $125,000. So there are a couple of members. Oh, great. Vanessa's got her hand up. Here we go. Family Focus has additional members. And so if multiple people from your agency want to talk, they can all raise their hands. Just let me know. Thank you. Vanessa, can you hear us?
Yes, can you hear me?
Yes, ma'am.
Hello, everyone. Good evening.
Good
I am
evening.
Vanessa Allen, and I'm the Program Manager and Center Director of Family Focus Evanston. We're located at 2010 Dewey Avenue in Evanston. The phone number is 847-475-7570. My direct extension is 211. And our email address is www.family-focus.org. So I'd like to start off with just talking a little bit about some of the programs that are at Family Focus currently. They include our early childhood program, which is a home visiting program, birth to 3, and we're charged with educating families with 135 children and 120 families. And this is all early childhood. Again, it's home visiting based, so it's not center based. And most of the visits currently are done in a hybrid type version, although we are kind of transitioning back into visiting in person, but virtual right now has been the way to go. When we also have our Family Advocacy Center, which is a DCFS funded program, which includes stabilizing families that are DCFS involved. We teach a lot of parenting classes, parent coaching, and things of that nature. And our youth development program, which is the after school program. I heard another organization mention Miss Joanne earlier, famous Evanstonian, who runs that program. And she works with approximately 50 youth every year after school and over the summer, and also with our grandparents program. And then just to put on the radar, FYI, we have coming in the new year, an Illinois Welcoming Center, which will be working with our immigrant population to help support those families as they integrate into our community. And in addition to our own internal programs, Family Focus houses several other organizations, many that we partner with and also receive referrals from for this particular grant that we're asking for renewal for, the case management grant. So it provides the services to the enrolled families and our community members. So this case management grant serves Evanston residents and also residents of the North Shore in general and some of the far north side of Chicago, if we can in some ways. These residents are usually lower income, based in our often single family households that are either referred to us by other organizations or are actually recruited by us because our workers currently do outreach in other organizations around the city and around the surrounding suburbs. So this funding helps us to be more intentional about the resources and referrals that we provide. It helps us to track the services and isolate the needs as they relate to our population. And it also helps us to provide the linkages that are necessary to empower and stabilize many family situations that could possibly threaten the family structure. Our services are free to the community and we are easily accessible. We have seen measurable improvement in areas such as if a family was referred to us or individuals that based on a hotline, DCFS hotline call or some sort of DCFS involvement or a call from a school official initiate the contacts. After working with us, we know that the families more often than not don't experience a follow-up call. And in many cases, the cases are closed in general due to the support that the families receive from us. We have a very long and solid history in the Evanston community, and this funding allows us to expand our services and increase our service delivery. And we like to continue to provide these services to our family, as Family Focus has been active in the Evanston community since 1976, and will continue for the very foreseeable future to be a force and a beacon in our community. So thank you, that's my presentation.
Wow, thank you.
Yes, thank you. That was great. Ken, you unmuted. Do you have a question?
No, I'm good. I'm good. I'm just soaking it up. Thank you.
Wonderful. Any questions for Vanessa? You were very, very thorough, Vanessa. I have none.
Nor do I.
Awesome. Wonderful. Wonderful.
Okay, next up, we've got the Housing Authority of Cook County. This is a
Renewed request for their original amount of $70,000 to provide case management services. They received a portion of the award in 2021 and another disbursement in 2022. And I believe Marcus King is here. to talk about that program, but if there are other HAC representatives, or if Marcus is not the person, please let me know. But Marcus, I'm gonna bump you up to speak.
Hi, Jessica. Hey, can you hear me?
Yes.
Absolutely.
Hey, everyone. Hey, so I'm Marcus King. I'm the Director of Strategy and Communication for the Housing Authority of Cook County. I'm wondering, is anyone else from HAC on the call? I had a few people who actually represent our properties in the northern region of Cook County, Evanston. I'm not sure if anyone's still on.
Derek?
Derek
I'm here, Marcus.
Oh, hey, Derek.
Sorry, we are a marathon committee. We should prepare folks for that. Ken, you got you appointed before you found out.
Hey, we're just happy to be here. I'll
It's
let Derek.
okay. I'm good. I'm good. Good introduction.
Okay. So a lot of it is I was really with this grant. This grant is very important. It's been very beneficial to the Housing Authority of Cook County. Roughly 40% of our population definitely needs this service. And I will definitely let Derek take over from here because he's interacting with the population on a day-to-day basis.
Yeah, so I don't have any specific numbers to tell you, but I can tell you the atmosphere and the feedback we've gotten from our residents is just great. They love having a full-time social worker there split between those two buildings. And it's really engaged a lot of our clients. And I actually even feel a difference when I go in there now. It just seems like especially, a little more of a community. Like people are working together and getting to know each other better too, as well as receiving services that they needed.
Yes, and as far as the numbers, Threshold has been reporting. From the time that Thresholds took over, what they have reported is those numbers as far as the clients served has definitely increased, and it looks like they're definitely interacting with the population extremely well. I'm going to go ahead and give you a backstory in regards to my work to explain how it ties in and explain these numbers. For 6 years, I was the Chief of Constituent Affairs for the Illinois Department of Corrections, and I created the reentry program, the #1 reentry program in the nation for returning citizens, the Summit of Hope and the Summit of Help. And I noticed these numbers, a lot of the social service needs, they've really been connecting with the people with the services as far as Medicaid redeterminations, DHS benefits as far as SNAP, cash and Medicaid, utility assistance, transportation, and just helping people move around day to day as far as just, functioning and just being able to interact with, people and just helping them with different things as far as primary, things they may have missed as far as primary socialization and secondary socialization as well. So this grant is extremely beneficial to the population that we serve, and it would really be great to continue this going into 2023. Mental health is definitely a big priority. It should be a big priority for everyone that has people who are vulnerable to suffering and need social services. Yet at the same time, mental health is just really a staple with these populations that we have in housing.
Absolutely. And I think that to the point of what Connections made earlier with Liz, of it's daily trauma. And so the need for that mental health support goes hand in hand, makes a lot of sense. And Derek, I appreciate that you outlined just your own experience of you felt and seen the difference in a sense of community within the Evanston buildings of the Housing Authority. I think that's really helpful to understand that not only, are people being seen and, because we don't want to just check boxes, but we want to feel that we're improving the quality of lives of those that we are we're trying to support. And so that was very helpful. Kathy or
Um,
Albert, do you have any questions?
Thank you. I was interested in knowing of the two, how long are the people staying in the house, the participants staying in the housing of the two buildings in a rough estimate? And do you have any plans to expand beyond the two buildings to a third building or something to that nature? Marcus?
Yeah, absolutely. As far as expansion, we're always looking to fill gaps and other opportunities. When it comes to mental health services, a lot of times people have very serious issues. I won't say that everyone is SMI. SMI is short for severely mentally ill. Yet when people do have mental issues and people aren't housing together, if a resident has mental illness, for example, they can become disruptive. And if they are in a property, they can make it disruptive for other people as well. And they can make it for a difficult situation even worse. So it's very important to have these services since they all have lived together. The mind state of a problem person or a person who is being disruptive should just be evicted, or we can put them in the streets. We can no longer do that. We can't afford to do that. So we can have these therapists on sites and things like that, and they can work with the people and make sure that they are taking their medications, making sure that they're involved in activities and keeping them engaged and keeping them focused and letting them know that there's actually somebody that does care about them and they're, doing something from the heart and it's not just about the paycheck. Then not only this gives us an opportunity to fight homelessness, but it also gives us an opportunity to keep people in quality housing. And not just that, it's a public safety issue as well. It's good for the community. It's good for the other residents who just live in the property as well. And another thing that I noticed, I'm going back and forth because I'm looking at the numbers that Threshold has provided. When they initially started, for example, the number of new service plans, I noticed when Thresholds was first able to take over the grant, Thresholds reported that they only had 6 participants. That number went from 6 to 62, all the way to 68. So in every category, the number of residents has increased exponentially. I noticed in January to June, from when it started, it was 11. Then in one category, we went from 11 all the way to 104, and from there to 115. And this is what Thresholds has reported to us. So it's definitely really beneficial. And we're working with other organizations as well with different properties. So I think these wraparound services are going to really tie in and just really benefit the community. I think there's a possibility that we can use Evanston as a national model at this point.
Thank you.
Oh, no problems.
Thank you. And to that point that you pointed out, that January to June, if I recall, there was a delay in getting set up. So it wasn't as though they worked those full 6 months. Is that right, Marcus?
Yes, ma'am. Absolutely.
Perfect. I just want to make sure that all the committee members recall, and that I recalled, that it wasn't as though they worked that full 6 months. There were some hiring challenges, if I remember correctly.
Yes, that is right. And I'm looking at the report. It's a very extensive report. Thresholds did acknowledge that there was a hiring issue, but it looks like once they get past that, they really jumped in and served that population. I just look at it. Sometimes people can have, disruptive behavior, and people can just look at them like, hey, the thing is, hey, they should just be evicted and put them on the streets, or, people don't want to live around them. And my, my status is, hey, get them treatment and things like that, help them out, and I know these people, this population isn't a correctional population, but at the same time, it was the same mind state that I had back then. The mind state shouldn't just be locked up, shouldn't just be, lock them up and throw away the key, help them, rehabilitate them. And in this case, it's the same thing, give them the services that they need and give them an opportunity to thrive and lead productive lives. That's what we're all here for.
Absolutely, absolutely, Marcus. And what I really appreciated is that you highlighted that not only do these services help that individual actually receiving those services, but it decreases disruption for the whole building, that whole community. And I think that's important to note, because it's not just those like 60, members or that are, and I apologize, we refer to folks as members of those 60 residents that are receiving services, but it's really the full, those two buildings are benefiting from this. So thank you for really pointing that out, because I think that's an important point that you highlighted.
Okay, thank you.
All right. I see no further questions. So I think next we're going on impact behavioral health.
Correct.
Yes, I have a quick question on.
Oh, I'm so sorry.
Yeah, no, it's all good. Just is somebody on the call from Threshold?
I don't know. If
not, I would just say the next time I'd love to also have someone from Threshold, since it seems like they put together the numbers and are delivering the services that we're talking about. So because I'll probably have more questions at the next meeting. I think we'll have another crack at this and be able to have people back to ask more questions. So we'd love to have somebody from Threshold at the next meeting.
Absolutely. Thank you.
Perfect. Thank you so much. And thank you, Councilmember Burns. I agree. That would always helpful. All right. We'll go to impact.
Yes, and there are several agency representatives from Impact. I see a hand raised already, so thank you. And it's Chris, again, just with us all night long. Chris, thank you so much.
Yeah, you're stuck with me again. Hi, everyone. Again, Chris Knoper from Impact Behavioral Health Partners. Our phone number is 847-868-8664. Our website is www.impactbehavioral.org, and our address is 565 Howard Street here in Evanston. So Impact is currently has a part-time case manager who provides a full range of services to a limited number of Evanston residents living in permanent supportive housing programs. Funding from the city of Evanston would allow us to add a full-time staff position to this program. Impact's background and specialty is working with individuals living with serious mental illness, helping them stay successfully and independently housed, and connecting them to their communities. All the individuals receiving case management services will receive services aligned with this mission and philosophy of care. We currently employ a Spanish-speaking staff in both the case management and employment programs, and have experience working with families living in Evanston, as well as undocumented individuals and those with undocumented family members. A typical intake into case management services would be a case manager meeting with a participant and talking with them about their needs and goals, along with briefly collecting demographic information for reporting purposes. Case managers meet participants in the location most comfortable for them, either conveniently located community spaces of their choosing or on-site at Impact properties and here in Evanston. The case manager can help a participant with many tasks directly. Those might include applying for or assisting with applications for resources such as subsidized housing, Medicaid, Medicare, SNAP benefits, subsidized transportation or transportation assistance, assistance with utilities or paying for utilities, and the city's general assistance program. A case manager can also help with practical matters like teaching a participant how to use their phone or email, budgeting, looking up and taking a new bus route, enrolling children in school, and connecting participants to community resources like affordable tax preparation, food pantries, clothing pantries, etc. The other role of the case manager here at Impact is referring participants out for more services. such as mental health care, primary care, employment services, or family services. There are two ways a case management participant can access additional services, either receiving them internally through Impact if it's a service that we provide, or referring them out to a partner agency. The main advantage of case management through Impact is that we provide a wide range of housing, clinical, and employment services internally, which participants can access seamlessly through the case manager. Impact also has a partnership with Wellness Home, which provides culturally competent primary and preventative healthcare to individuals who might otherwise have difficulty accessing healthcare. Wellness Home actually sees patients once a week in Evanston at one of our Impact-owned buildings. Additionally, Impact already has close working relationships with other providers, including District 65 school counselors, Erie Family Health Centers, McGall YMCA, City of Evanston General Assistance Program, Evanston Public Library, Peer Services, Connections for the Homeless, and the Housing Authority of Cook County, to name a few. Our relationships with these agencies help participants access services in a timely manner. Many of these partner agencies also currently refer their clients to Impact's case management program. And then one final key point that I think makes our case managers special is that our case management services are performed under the direction of a licensed clinical social worker, and our case managers are part of a clinical team consisting of several licensed clinicians, a program nurse, a housing support specialist, an employment specialist, and a psychiatrist. Case managers meet weekly with this team to consult about challenging cases and can draw from the expertise and experience of this team to assist their participants.
Thank you so much, Chris. Councilmember Reed, you have a question?
Yeah, I just want to just voice my utmost support for Impact. They're located in the 8th Ward. They're a treasure to the city and this area. So just wanted to chime in.
Perfect. Thank you so very much. And yes, they do wonderful work. And thank you, Chris. That was very, very thorough and helpful. And I'll open it up for further question or comment. All right. I'm hearing none. We will go to the next group, and I'm scrolling Interfaith Action.
Correct. So this is, I'm sorry, Interfaith Action was awarded in prior years. This award is an increase in the request. Interfaith received 42,500 last year, and the request is for 75,000.
I lost my voice. Hi, this is Susan Murphy-Burby. I'm the Executive Director of Interfaith Action of Evanston. Our phone number is 847-869-0370. Email interfaithactionofevanston.org. Our office is at 1004 Greenwood in Evanston, but we have centers at more than 12 different sites around town at different faith communities. Interfaith Action provides services to people in Evanston who are experiencing hunger and homelessness, including a daily morning shelter providing breakfast and daily soup kitchens. 41 of our faith communities in Evanston are active members. Our proposal includes 2 specific services that we provide. The overnight shelter has been a part of our services for about 15 years. We started by opening at one church when the temperature reached 0 degrees. Over the years, we've grown to 9 different faith communities, each giving us at least 3 weeks use in their facility. We added 4 weeks this year and are now open every night from October through May. Due to COVID restrictions, we've been serving only 20 people each night, but Agbo just last week gave us permission to raise the number to 25 as long as we put the cots head to toe. Once a person gets a bed, they can keep it for as long as they need it if their attendance is consistent. We serve men and women over 18. We have 2 overnight staff each night, but volunteers help welcome our guests and give them blankets and sheets, and they give them kind words. I think often volunteers receive almost as much as the guests. They enjoy hot drinks together, have conversations, and discover that there's not much difference between them and those experiencing homelessness. We hope to add at least another month next year until we're open all year. No one should have to sleep outside ever. The other program is a SNAP-GAP program, and it's relatively new. The program addresses the needs that the SNAP card doesn't cover. Each month, we partner with the Greater Chicago Food Depository at the Robert Crown Center to distribute fresh produce. We serve over 250 families each month. We ask the people who attend what other needs they have. The two main needs that they talked about other than food were laundry detergent and toilet paper. One person said that he had not been able to afford toilet paper for the last 3 years, and I did not ask what he was using instead. We purchased the toilet paper in bulk and started providing each person who attends the Produce Mobile with 4 rolls each month. We hope that that helps them to be able to put the saved money toward food and housing. We serve everyone. Most of our recipients have families and many are elderly. I live near Robert Crown, and one evening a group of neighbors were sitting around a bonfire in my backyard. And one woman who owns a home in the neighborhood said that she saw a group of people at Robert Crown that morning. She walked over to see what was going on. Her husband had been out of work for a while and they have 2 children. She said she received enough potatoes and carrots to feed her family for a month and toilet paper. We serve people in Evanston who are just like you and me, but are struggling through difficult circumstances. So thank you for so much for considering our proposal, and thank you for all the help that you have given us in the past.
Thank you.
Yes, thank you so much, Susan. What a wonderful description of the work that you do. Questions from the committee?
So this amount of money, this request is so that you can have longer months in action. I'm sorry, I'm losing my ability to speak. Months in action, serving the community that are on the fringes that many of us don't even know about. Is that correct, Ms. Murphy?
Yes, and it's we serve the people who are actually homeless. Everyone who comes to our centers, it does have a caseworker at Connections for the Homeless, so we work really closely with them as they try to get them housed. We're kind of the emergency people in between that provide them a place to stay, a place to sleep at night. So the goal is to continue to add weeks until we are open all year long.
And you have many volunteers and that help with the staffing of the organization. I must admit, to be real honest with you, I'm just blown away with the kindness and humanity of providing people with toilet paper, because no one ever thinks of that.
Oh, thank you. Yeah, we didn't think of it either. It really was asking the people who come there what it is that they have to go without, because they just don't have enough money. And it's your neighbor, my neighbor and your neighbor who are, living in Evanston, have a home, but are just struggling right now.
Wow.
Absolutely. Wow. And I think, Susan, you make such a great point that if we don't include those we serve in developing of whatever programs, we miss the mark. We create better programs by asking what folks need. They know what they need. And so thank you for highlighting that this evening, and for the work that you do, and for serving our neighbors and making our community stronger.
Thank you.
All right. I see no further questions for you, Susan. So thank you. And I have Infant Welfare Society next. I believe. Okay, great. I'm like.
Okay, so Infant Welfare Society
It has 2 applications. In the past, they've been funded for their case. Excuse me. In the past, they've been funded for case management services for 75,000. This year, they're requesting funds for their flat funds for their case management services, 75, and then an additional 75 for safety net services. And just as a reminder, these services are for their teen baby nursery and their baby toddler programs. So Tiffany has had her hand up. Tiffany, can you hear us? Oh, I'm sorry. And Pam Staples is also coming to talk for the organization, as is Stephen Vick.
Yeah, hi, this is Steve. Can you hear me okay?
Absolutely.
Hi, everybody. I'm going to kick us off and just give you an overview of our organization and then pass it to Pam and Tiffany, respectively, to talk about the two applications. My name is Stephen Vick. I'm the Executive Director of the Infant Welfare Society. I've been here for 8 years. Our organization has 3 main sites. We're focusing on the teen baby nursery and baby toddler nursery in Evanston, but we do have a home visiting site that is based out of Skokie, and it does serve some Evanston residents as well. As an organization, we're about a $3 million organization with 50 staff. We have to raise about maybe $800,000 every year to operate. And that comes in all sorts of forms in terms of our budget, but we do depend on raising a lot of money to sustain our programming. We serve about 150 families totally in our 3 programs. I'll focus real quick on Teen Baby Nursery is in the 5th Ward. It's an early Head Start program connected with District 65. We're a delegate agency and the only partner of District 65 in the 5th Ward. Our focus is on 0 to 3. We do serve prenatally as well, but our classroom-based programs start at 6 weeks and go to 3 years old. Just some quick demographics. Our teen baby nursery staff is 100% POC. Again, 16 family we serve there. At baby toddler nursery, our staff is about 80%, 85% POC, and we serve a total of 70 families there. Our children are 44% African-American in total, 19% Asian, 18% Hispanic, 14% white, 4% multiracial, 1% unreported. The last thing I'll say before I pass it to Pam and Tiffany is that I believe our organization is one of the critical and one of the most important organizations that's doing prevention work with our youngest residents. We've been around for 110 years. We're one of the oldest nonprofits in Evanston. Baby Toddler Nursery was founded in 1971 as one of only 5 0 to 3 licensed facilities in the country. And we were one of the first we were the first in Illinois. Teen Baby Nursery serves parents ages 14 to 26. And that started in the 90s with a partnership with the high school. And we still partner with Evanston Township High School, even though some of our parents are a little older than high school age. So I'm going to pass it to Pam and Tiffany to talk about the specific grant applications. Thank you.
Thank you.
Hi, can you guys hear me?
Absolutely.
Okay, good evening, everyone. So I'm going to talk a little bit about the case management services that we have been utilizing. We've been so grateful to be recipients of this funding recently and in previous years. And like Steve said, our primary function is providing high quality early childhood education to our children ages 6 weeks to 5 years old. Our age range at teen baby for the parents are ages 13 to 26, with currently right now our youngest parent being 16 years old. As a component of our programming, we provide case management services to all of our participants by employing family advocates. As you know, when parents are well supported, that support trickles down to the overall health and well-being of their children that we serve. And we have seen since the onset of this pandemic an increase in needs from our program participants in a variety of areas such as housing, stability, adult education, and mental health supports. When fully staffed, we employ 2 family advocates who work with our families to set SMART goals with them in these various areas of high needs. This funding allows us to continue offering these highly focused, individualized case management support services to families. And with that, we have been able to serve about 38 Evanston families, creating individual plans that focus on support and helping to achieve their goals and access resources to help sustain them and their families. Right now, we have about 7 Evanston referrals that have been made to actually many of the agencies that are on this call tonight. We have been able to receive support from agencies such as CNE, their mental health program, and also from Connection to the Homeless to support our families. So we are currently working with 11 new case management service plans this year. And some of the highest needs and support needed from our families continues to still be housing stability, financial asset, and job security. So what the family advocate does is work with these parents, set these goals, and help find resources that are available to walk alongside these families when we are developing the goals. Each month, we hold a variety of parent engagement meetings and workshops targeting these highest needs, again, with some of the support of the agencies on the call tonight. One example of assistance from one of the agencies is in particular Connection from the Homeless. We were able to host a parent meeting to talk about affordable housing, which is really have been a topic of discussion tonight too. And many parents have reported that just this piece of the case management has been very beneficial in helping them to see what steps they need to take and finding affordable housing, but also managing. And so going back full circle, when the parents are able to provide the needs for themselves and for their families, it just makes a stronger way for their child to be educated in a safe manner and in a safe environment. To help us to keep track of all of the case management services, we use a wonderful database that documents and aggregates progress over time, which we're able to capture each month. And so we really do appreciate the funding that has allowed us to continue to support our families, but we have seen now a shift in the need with our children and the need of having additional funding, which is why we have now requested some safety net funding to work with our families in a variety of aspects. And our site director from Baby Toddler will speak to what the safety net services would look like in continued support of our programming. Yeah.
Ms. Staples, you're still muted.
Sorry. Can you
No
guys
problem.
hear me?
Be sure.
Hi, my name is Pamela Staples, and I am the site director at Baby Toddler Nursery. And I'm just going to piggyback off of Tiffany. Tiffany is the site director over at Team Baby. IWSC, Infant Welfare Society of Evanston Baby Toddler Nursery, and Team Baby Nursery. We are both center-based programs, and we provide comprehensive wraparound services for the children in our programs. And primarily, we serve children that are 0 to 3, but we do have children that are also 3 to 5 years of age as well. We observe, assess, and make informed decisions along with the parents about the health, safety, and educational needs of the children. Being an early Head Start program, and as I want to reiterate again, serving primarily 0 to 3 children here in Evanston, I want to focus on some of the things that sort of help us maintain and be able to provide the services that we need for our children. We have what is called a multidisciplinary team. So that team consists of an infant mental health consultant who primarily looks at the behavioral and emotional regulation of our youngest learners. We have a developmental services coordinator who navigates children whom, we do within 45 days of children coming into our program, we do a developmental screening. So that screening sort of helps us see where children are on their trajectory of their learning and development. And sometimes, if more often, children do need some support. So for instance, if they're coming in with language delays and such, we want to sort of run that by the parent, talk to the parent to see what they're feeling in regards to their children having maybe a slight delay in language. So this developmental services coordinator will help navigate sort of getting those referrals sent out to early intervention so that those services can then be transferred into our program. For instance, speech, OT, DT, developmental services can be transferred into our program. We have a health specialist who looks at well baby exams. She does within 45 days of children coming into our program. She does a hearing screening for the children as well as a vision screening. And a lot of times the health specialist looks at health and nutrition because sometimes, again, looking at how very young children in terms of their nutrition, particularly infants, what meals need to be served to them. She's a great support to our staff. She's also a great support. Sometimes families, when they go to the doctors, they feel like they're not being heard in terms of what they need for their child. The health specialist will sometimes accompany the parent to the doctor's office to sort of be an advocate for that family. We have an educational coordinator who is in charge of curriculum. And so she ensures that teachers are providing engaging and appropriate activities for very young children. We do have a speech pathologist. Sometimes children who don't qualify for early intervention still might need some support in terms of language or things of that nature. She is there to sort of help
Pam?
give additional push for children. Sorry,
There we
Rose.
go.
Sorry.
No worries. And I will just say, wonderful information. We are a little over time on this presentation, so I don't want to cut you off, but I just want to give you that
I'll wrap it up.
warning, if you will.
So again, we meet 2 times a month to with the teachers to talk about the child's well-being. So I just want to wrap it up and say, right now with the consulting team, their time is sort of limited in our program. So we want to be able to have them at our program a little bit more. And I believe that these funds, additional funds, would allow them to spend more time at both Baby Tyler and Teen Baby to help us continue to help children grow. So again, our goal is to have children when they leave our program to go to kindergarten and the preschool to have a strong start. So this will help us help them have a strong start in moving into formal schooling. Thank you.
Thank you so much. Questions from committee members?
I don't have a question. I just have a comment. I think it is so important to facilitate these wonderful, beautiful children at a very young age and to help their parents along, no matter what the age of the parent, for supportive services, because I truly believe it does take a village. And thank you very much for the presentation. The money that you're asking for will increase the services to actual parents with staffing, is my understanding for one, and to expand the services for the other request, if that's correct.
Correct.
Yes, that's correct.
Thank you so much, Mr. Vick and Ms.
Thank you.
Staples
Thank you so much.
and Ms. Tiffany.
Thank
Cool.
you. I'm just to say ditto to everything Kathy said. All right, that'll bring us to meals at home delivered meals.
Yes.
Meals on Wheels, okay.
Oh, I apologize.
Meals on Wheels is a returning applicant. In prior years, they've requested $30,000. For 2023, the request is for 50.
Deborah, go ahead and kick off.
Can you hear me?
We can.
We're still awake? Okay. Deborah Morganfield, Executive Director of Meals at Home, DBA Meals on Wheels, Northeastern Illinois. We are, the program is home delivered meals to a rising number of older adults experiencing malnutrition and hunger. Y'all know us, I think. We're right on the corner of Simpson and Darrow in Evanston, 847-332-2678. Website is mealsonwheelsnei.org. We've been around since 1968, started out with a bunch of Fifth Ward legends, getting the organization on its feet. And I have personally spent the last 9 years trying to honor their work and do it justice. In 2020, we moved into, well, 19, we moved into the location at Simpson and Darrow, and in 2020 opened the food production facility, the first one that the organization has ever had, and not by accident that we opened it in the Fifth Ward. We're doing all that we can to serve as many homebound people as possible, predominantly older adults, but also folks who just have trouble preparing meals on their own due to some sort of limitation. I have a couple of stories that I'll just breeze through very quickly, given the hour. Spoke with a man yesterday who is just coming onto the program. He lost his wife a few years ago when their home burned down. So he lost his home, and his wife of 47 years is now in a new home, which his daughter got him all set up in, and he's on oxygen because of injuries he sustained in the fire. Moved in next door to a man named Carl, who also lost his wife, and the two of them have become friends, and they both decided they need Meals on Wheels because their wives always cooked for them. We have another woman who had been a social worker for years, and now she says the shoe's on the other foot. She needs help herself. And then one last story, just a couple that has been sharing meals and started getting meals from us. Our meals are modestly portioned. They're meant intentionally to be just enough so that we don't have food waste and issues with expiring food. And this couple started out sharing a meal. So I was working with them this week to try to encourage them to each have their own meal that is appropriate nutrition. So those are the kinds of people that we're helping. As I tell the little kids who get off the bus in front of our building in the afternoon, we serve the grandmas and grandpas in the area who have trouble accessing food for themselves. We've been partnering with the YMCA to deliver meals to some of their residents. YWCA, we assist when their kitchen is shut down over the holidays. We work with Connections for the Homeless on some of our leftover meals. We do some extras each day to make sure that we don't run out, and then we'll send the extras over to Connections for their folks. We're also the emergency food provider for the regional Red Cross. So when the tornadoes hit west of the city a couple of years ago, we were the people providing meals to their people. Some quick statistics. We were projecting that we would serve 80,000 meals this year, but the way that things have been going, it's more likely that we'll come close to hitting 100,000. Staff and inventory costs are, of course, increasing, and we're trying to do right by everybody. And I believe very strongly in paying everyone a living wage. We also have been able to add benefits this year. That was a decision that the board made and feels very strongly about. I'm very pleased with them for taking that path. But lots of great increases in terms of people. We're just short of 500 clients last year, and already this year, year to date, at 287. I would expect that we will get close to 900 this year over the course of the year that we will serve. So just really strong growth throughout the organization. Of the Evanston route specifically, when I started, we had 4, and now we have 10. And we're covering other areas as well, of course. But the other notable thing that has really hit us hard, we used to subsidize about 60% of our clients, and we're now up to 89% of our Evanston clients who qualify for reduced rate meals. 75% are trying to live on less than $1,700 a month. 52% of them less than $1,000 a month. So we're really happy to be able to step in those situations in particular. We're adding one additional meal option so that they have their choice of 3 different meal options and 3 hot meal options and 3 different cold meal options. That is something that a lot of Meals on Wheels programs aren't able to offer any choice. And the fact that we can give 3 is pretty remarkable. That 3rd choice that we're adding on now is a Latinx inspired menu. So we're really proud of that. Definitely want to be welcoming to everyone, and trying to make sure that that's reflected in the flavors that we offer.
Thank you so much, Deborah.
I think that's everything. I've probably gone over. I'm sorry.
It's all right. I think that, at 10:30 at night, you still remembered to, you still brought in like why we're here. And thank you. I have no questions. You answered so many that were sort of popping up. You were very thorough. And just thank you for the work that you do.
It's an honor.
Any questions from the committee?
No, ma'am.
You just
None.
knocked it out of the park. You
Right.
I don't know
really
about
did.
that. I
Those
still
stats
have to
were
sleep.
wonderful. No,
I'm
you're
usually in bed by now.
same, but that's all right. All right, Deborah, thank you so much. We have
Thank
to
you.
move-
I appreciate you all and all of your past support. That's really a huge help to us.
Thank you. Thank you.
All right, so next I'm going to invite Kristen Kennard from the Moran Center to speak. So the Moran Center has 2 applications for 2023. They had 2 applications in prior years, and Kristen will speak. One is for case management services. Here we are. And the other is for case management and safety net services. Those are the only 2 we're hearing. The case management is at level funding of $75,000, and the safety net services, there is a $25,000 increase. They received 50 last year, and they're requesting 75 for this year's safety net services.
Kristen, go ahead and take us away.
Thank you both. Can you hear me?
Yes.
Absolutely.
Okay, great. Well, first of all, hello, everyone. Thank you so much for having us here and for spending so much time tonight going through all of this. My name is Kristen Kennard. I use she, her pronouns. I am the Deputy Director and Director of Social Work Services at the Moran Center. We are located at 1900A Dempster Street in Evanston. Our phone number is 847-492-1410. And our website is www.moran-center.org. So the Moran Center provides integrated legal and social work services to low-income youth and young adults and their families in Evanston. Our goal is to provide youth and their families with the support to successfully emerge from a challenging legal situation, tools to make positive life choices, and the ability to thrive in the Evanston community. So to meet those goals, our programmatic approach focuses on justice in the courtroom, access to the classroom, and restoration in the community. To talk a little bit about who we serve, specifically case management, 75% of the Moran Center social work clients, which are our case management clients, identify as very low income, and 21% identify as low income. Of these, 18% in this past year were homeless. 37% resided in female-headed households, often being raised by a grandparent. In terms of age, 21% of our social work clients are children under the age of 17, and 79% are emerging adults. Our client population is racially and ethnically diverse, with more than 90% of our clients identifying as BIPOC. Funds from the Social Services Committee have subsidized and will continue to subsidize portions of our social work and mental health staff salaries, which we have managed to serve an increased number of clients in year-on-year comparisons. We're currently a team of 4, and I very excitingly can say that as of today, in January, we'll become a team of, we're a team of 3, we will become a team of 4, sorry about that. 3 out of the 4 of our case managers and therapists identify as BIPOC. We have 1 Spanish-speaking case manager and therapist, and we have a Black woman therapist who will be starting in January. Our case managers provide both case management services as well as therapy and therapeutic services. Because many of the youth and families who we serve are challenged by complex psychosocial situations and crisis, our case managers and social workers are on hand to provide crisis intervention, case management, and trauma-informed therapy. Sessions are, it depends on the need of the client. It may involve a few sessions for case management, or it could involve more intensive therapy sessions with case management for 6 months, a year, or in more complicated situations for many years. The social work team applies evidence-based and evidence-informed practices in our clinical work, including the use of motivational interviewing, trauma-informed cognitive behavioral therapy, elements of mindfulness, and strengths-based principles with interdisciplinary coordination of care. All of our services are completely free, and they do not require any type of insurance. Each client develops a service plan with their case manager, with their social worker. All of this whole process is client-driven and client-centered. We really want to uplift our clients' voices and what they feel that they need. Some of the common things that our case managers will work with clients on, or that they will identify that they need, are finding and maintaining a job, learning how to budget, obtaining identification documents such as an ID or a social security card, accessing health insurance or public benefits, accessing medical care, which can include primary care, psychiatric services, dental services, seeking further education, securing stable housing, and then learning coping skills and managing their emotions. Typical outcomes of a service plan include clients taking necessary action steps with the guidance of their case manager to complete their stated goals. But another typical outcome is the successful linkage of clients to other social service agencies that we partner with, many of whom you've heard today. We all work so closely together, and it really does take a village, and our clients couldn't meet their individualized goals without these connections and without these linkages. Our client's idea of success is noted in each service plan, and success looks different for everybody. It may be completing a specific goal, or it may mean taking a few steps towards a goal. It's also measured by however that client identifies success for themselves. We recently developed a survey that addresses both client satisfaction with services and satisfaction in life, as well as their perceived progress. Results of this survey are not directly related to a client's success, but they are taken into consideration in modifying their service plans, as well as evaluating the Moran Center services for effectiveness. All of these things contribute to the overall well-being of our clients. So I don't know if you want me to go, because I'm doing both. You have to hear from me for both case management and safety net. You want me to go straight into safety net, or if you want me to break and see if there's questions for case management?
Let's break and see if there's questions, since there's a nice pause here. I think I don't have a question so much as you walk through, Kristen, your next one, if you can sort of highlight how you differentiate the funding and just to sort of highlight that, how you use those unique pools and how that works. I think that's always helpful for us to understand.
Sure. And I can say for case management, obviously the funding from social services, from the committee, goes towards staff salaries. And then we also use other government funding and city funding and our fundraising efforts with individual donors to supplement what we need to the rest of our salaries for our staff.
That makes sense. Thank you.
Sure.
Other questions before Kristen dives in? Go
Yeah, my
right
only
ahead. Go ahead.
question was about the kind of satisfaction surveys. That's something that I think is typically missing in kind of social work is as much as I think the goal is to be client centered. I'm always surprised on how little data sometimes is collected from participants and how they feel about their experience. And so I don't know how much of that you can share, not necessarily today, but I'd certainly be interested to understand those results. I don't know if they were in the packet. I couldn't get as deep as I wanted to in this packet because I was preparing for the first agenda item, but I just wanted to make that note.
Sure, and I can say quickly without diving into all that, and I'd love to have any offline conversations about it. This is something that has been with this strategic plan this year. One of our main priorities is gathering data and evaluation, and it's a really difficult to do within social services. But we understand the importance of it, and so we started with a text survey. That didn't get very good responses, so now our case managers and clinicians are implementing a quarterly survey that we have clients do while they're with us, and that again measures satisfaction of services at the Moran Center, life satisfaction, and then also measures and keeps track of progress of specific like mental health symptoms. So we're talking about generalized anxiety and PTSD, and that we just started a couple months ago. So data is coming in. We just had our first round of surveys due, so we will be having much more of that data in the upcoming year, but it's something really important for us.
Yeah, and if it's not included in the packet, whatever you can include for the next meeting would be helpful. Again, understanding the limitations of what you might be able to share, but any kind of anonymized data would be helpful.
Sure,
That's
I can
all,
see
Chair.
what
Thank you.
from the beginning. It is very new, so we are still waiting to compare data over time. And so
Right, yeah. No,
but I'd be happy to share what we're measuring, what we're asking for in the surveys, and
Okay.
evaluations that we do have.
Perfect. All right, that's all, Chair. Thank you.
Thank you. Sorry, I struggled to get off mute there. All right. Kristen, you want to dive into your next presentation?
Sure. So for safety net services, demographics are very similar, so I won't go through all of that again, considering time. But the requested funds for the safety net category are for the continuation of our legal services, including our school-based civil legal clinic and our education advocacy program, as well as our representation of Evanston youth through the age of 26 who are involved in the criminal legal system. And our goal with these programs is to stem the poverty in school to institutionalization pipelines and improve opportunities for youth and families. And again, the funding from the Social Services Committee goes to portions of our staff salaries. The Moran Center's school-based civil legal clinic provides free legal advice and representation for disinvested families in District 65 with issues related to basic human needs, which include safe and affordable housing, consumer protection, family law, public benefits, and others. When legal problems create family instability, there are often negative effects on the student's learning. So the goal of the legal clinic is to stabilize families so that children can stay on track in school and be successful with their education. Currently, the school-based civil legal clinic is staffed by 2 full-time attorneys, one primarily dedicated to housing law, and a cadre of 28 pro bono attorneys that help us out. Our education advocacy program is staffed by 3 attorneys. They advise and represent low-income students with special needs to obtain services they need to make progress in school. They advocate for students facing school discipline and empower families with the tools to advocate for their child's educational rights without representation. Evidence shows us that earlier intervention and social support for families who have children with disabilities is one of the most effective ways to prevent problems of academic failure, disciplinary issues, and delinquency, and improves opportunities for jobs and higher education further in life. And finally, our youth and emerging adult criminal defense practice advocates for children and emerging adults caught in the criminal legal system, ensuring due process of law and zealously advocating for legal outcomes that avoid young people from being defined by their worst mistakes. For our safety net services, we capture our clients' needs and goals in our data management system, which is LegalServer, including capturing the legal problem which brought them to us in the first place, what additional non-legal resources the client requires to resolve the underlying matter, as well as what self-efficacy strategies we relay to clients. We additionally track the tools and interventions employed to help meet and solve our clients' needs and to attain their goals, such as providing legal advice and representation, recovering assets, making referrals to outside organizations. Again, all services are free, no insurance needed at all. Our services qualify as safety net because our free legal services urgently respond to immediate crisis experienced by community members confronting destabilizing civil legal needs, addressing school failure or school exclusion, and/or facing the criminal legal system. Our legal services also aim to stabilize low-income youth and their families in conflict with the law and/or institutions, mitigate collateral legal consequences, and ultimately preserve future opportunities. And again, we use case closing forms and text and email servers via LegalServer to track client outcomes and feedback across all legal practice areas. I can get you more information on that. We hold quarterly sessions to review this data and discuss what we've learned. That information from the surveys will inform our ongoing effort to fill any relevant service gaps that our clients are experiencing, as we have historically done. We'll also utilize these touch points and data as ways to track how clients want to be a part of our organization, organizational leadership, and community change. And again, just because I know this question has been asked, 2 out of the 6 of our attorneys identify as BIPOC. We have 1 Black male attorney and 1 Hispanic attorney and 2 Spanish-speaking attorneys.
Thank you for reading our mind. It's a pleasure.
Thank you.
That was really great. Thank you for answering our questions before we asked them. Kathy or Ken or Councilmember Burns or Reed, any other questions for Kristen?
So I just,
No, oh, sorry, Ken, go ahead.
I just have a question about, are both of these, I'm trying to follow the list of grant of requests here. Are both of these prior year, were funded in the prior year? Okay, so there's, okay. Thank you, that's all I need.
I just wanted to say thank you to the folks at the Moran Center for everything you've done. I mean, it's wonderful work, and I don't know if you get to hear thank you enough. I'm sure you do, but here's another one. So thank you.
Thank you, I appreciate that.
Wonderful.
I did have a question. And sorry for the echo. I am doing this and doing a little housework. My question is, there, based on what I've heard, there is a attorney who works in Moran, has worked in housing, so representing people in kind of housing court. I think more commonly known, referred to as eviction court, but I think it's housing court. And this person, really good, really talented, really skillful and experienced attorney, but was either still on leave or was on leave. And then there was another attorney that stepped in. I think we talked earlier on, not necessarily about young attorneys, but just young, I think it was therapists and counselors, a lot of eagerness in discussing, how much, the lack of experience correlates with skill. I think particularly though, in the practice of law, it does. And it helps to have an attorney that is experienced, especially someone that's representing clients in court. It can make the difference between, in my opinion, an eviction, whether they get evicted or not, or even things less nuanced than that are still make a big impact. And so my question is that if you're following what I'm saying and what I'm saying is true, is that person back, and if not, is and again, I think this particular attorney is maybe experienced in another practice of law, but is new to housing. And so if that other person I talked about is not back yet, I'm just trying to make sure that person who is there now is getting all the help they need to get caught up. And that's really important, because I've heard some concerns, not on that individual's kind of personal attitude. I think it's great attitude. eagerness, all of that. But again, when you're in court and, your housing is on the line, I think people are looking for that experience when it comes to the practice of law. So I just wanted to bring that up.
Yeah, so our managing attorney has been out for personal reasons. She will be returning at the beginning of January. The individual who has taken over is somewhat new to the Moran Center as of March and has had to take over that entire practice with the help of some pro bono attorneys. He gets supervision and support and help through other attorneys in our office. And that is one of our programs that increased, as anyone could guess, throughout COVID dramatically. All of them have, but that was the one that increased the most in regards to housing and evictions. And so he is working with his volunteers and our other attorneys to address as many cases as we can while we are trying to cover for this other attorney, but she will be back in the beginning of January.
Beautiful. Thank you so much.
No problem.
All right. I see no further questions. That would be next would be North Shore Senior Center.
Yep. So, oh, great.
So this is a North
Shore Senior Center is requesting 35,000. This has been their request for the past two years. And it is for essentially the same services, although Kathy, correct me if I'm wrong.
Same services. And should I start talking now, or are you going to say
Go
something?
right ahead, talk, and
Oh.
we have your email and your phone number and your website. So just dive
Okay,
into your.
so you don't need that. I'm going to just launch into a really quick summary since this isn't the first time we've been here. North Shore Senior Center, we serve the older adults who live in Evanston and their families, including family caregivers. There are also a handful of children that we're serving through our Grandparents Raising Grandchildren program. We serve 2,200 unduplicated Evanston residents in 2022. And the majority of the people that we have worked with fall in the low to moderate income category. We help connect people to the needed programs and resources that they need so that they can remain in their homes and delay or avoid the need for nursing home placement or homelessness. Our focus is on meeting the needs of older adults, and we do this by assessing their needs. We look at their physical, financial, environmental, medical, spiritual, transportation needs, and then connect them to the resources that will help them get those needs met. And in many cases, we have clients that we serve for many, many years, because once we get their situation stabilized by maybe bringing in some home care services to help them maintain their homes and getting them established with programs like energy assistance and Medicaid and things like that, we then help them maintain those programs and services. And as their needs change, we're able to bring in different and additional services. So it's really that ongoing care coordination service that is so important, that we would like the city's assistance, financial assistance, to help continue to pay for our staff to provide those services. The overwhelming majority of our work is in the community. We see people in their homes. And in the city of Evanston, we also see people at St. Francis Hospital and Evanston Hospital. Just want to check my notes real quick. That is like the main overview, and we really do our best to see people. We triage people as referrals are made to us. We triage the situations to really make sure the high priority needs are served first, but we do make a point of serving every single person that comes through our doors or is referred to us.
Thank you so much. Oh, if you have anything else, Kathy, feel free, but
No, that was it. I was just going to say, if you have any questions, what can I answer for you?
Any questions from committee members? No, I think you, first and foremost, we've heard from you before, but also you did a really thorough job, and bless you, Jessica. So thank you so much, Kathy, for your time
Thank
and
you.
for staying with us. I know that it has been a late night, so thank you very much. Peer Services.
Trying to figure out how this all works. I'm Ann Brown, the Development Director at Peer Services. We are applying for funding for our substance use treatment services to low-income Evanston residents. Our number is 847-492-1778. Our web address is peerservices.org, and we're at 906 Davis Street in Evanston. So I'd like to begin by introducing our new executive director, Noy Friel Lopez, who you can't see, but he is there somewhere in virtual land. Noy is a clinical psychologist and certified alcohol and other drug abuse counselor who has dedicated his career to working with underserved communities, providing innovative programs and services in mental health, substance use, and crisis stabilization. His leadership is just what we need at Peer to deepen and expand our impact in the communities we serve, and we are super excited to have him on board. Peer is the main safety net substance use treatment provider for vulnerable teens, adults, and senior citizens in Evanston. This includes residents who are unstably housed, veterans, and justice system involved individuals. We see most clients within a week of their initial contact, and we prioritize those in crisis and see them within 24 to 48 hours. Unlike many private and nonprofit substance use treatment providers, Peer accepts all clients in need of services, regardless of their insurance status or financial resources. 85% of the Evanston residents we serve have low to moderate incomes, and most use Medicaid or Medicare. For uninsured clients, we offer sliding scale fees that we can slide down to zero if needed. Funding from the City of Evanston helps to fill the gap between Medicaid and state reimbursement and the true cost of high quality services. Substance use disorder causes harm to individuals and those around them. It harms relationships with family and friends, often leads to failure in school, lost jobs, and economic hardship. Prolonged use can cause significant health problems, including serious illness and death related to those health issues or related to overdose. Substance use disorder can also lead to repeated and prolonged involvement with the criminal justice system or with DCFS. Peer's team of master's level counselors and social workers, along with our medical team, use an evidence-based, trauma-informed, and holistic approach to substance use disorder treatment, which helps our clients address the underlying issues related to their substance use and develop the supports and coping mechanisms that help them stop using and sustain their recovery. And I just want to quickly highlight one of the things that our clinicians do in addition to providing individual or group therapy is that they offer some therapeutic groups as well that are sort of an add-on for our clients. One of them is an art group on Friday morning, and our clinician recently helped the clients create an art exhibit at the Glenview Public Library called The Joy of Recovery. And so instead of highlighting all the challenges that people go through, which are real related to recovery, she really focused with the clients on the joy that they found in taking pride in recovery, in going through that process, in whatever was inspiring to them. And then she took some of the clients with her to see their art. And she reported back about how awed they were by seeing something they had created on display for others. Because so often the stigma around substance use disorders is incredible. And the people who experience substance use disorders feel terrible about themselves often. And so our clinicians work all the time on helping them flip that script, stop the negative patterns of thought and really be positive. But then to have it happen in reality, to see their artwork up there and be like, wow, I never thought that I would have anything like that on display, was just really powerful for us.
That's wonderful. And I absolutely understand why it would be powerful. And thank you for sharing that, Anne. Questions from the committee? And thank you to your commitment to Medicaid and serving clients regardless of their ability to pay.
Thanks.
And serving them for so many decades as
Yes.
Peer Services has done.
Yeah,
here in
we've been around
Evanston.
since 1975.
Yeah. And welcome to your new director.
Yes, welcome. Thank you so much. And sorry that your first meeting is so late.
So long.
Yeah.
All right, well, thank you.
Thank you so much. Next, we have YOU.
Yes, so YOU.
Is, I'm sorry. YOU originally requested safety net and case management services at the recommendation of staff. They consolidated to safety net services. And we've got a couple of members from YOU. So Leslie Martin, I'm not sure which one of you would like to present, or Teresa. Should I just promote everybody?
Yeah, perfect.
Oh, great.
Leslie.
Yes, hi, it's Leslie Warner, she, her, hers, I'm the grants manager with YOU, and actually Teresa Cortes, who is our Director of Clinical and Outreach Services, is going to be doing the presentation, but I'm here to back up with any questions.
Sorry. Teresa, can you hear us?
You're still muted, Miss Teresa.
There it is. I see it. All right. I'm not a night person, so bear with me. So YOU provides safety net services to a broad population of primarily low-income Evanston residents. Most of YOU's clients and youth and young adults ages 9 to 21 and their families. The vast majority are youth of color and youth who qualify for federal free and reduced lunch programs. Youth who identify as LGBTQ+, who are runaways, homeless, or experiencing a housing crisis, such as being locked out, and or are immigrants or refugees. ESL families account for a sizable percentage of our clients. Our clients face tangible unmet needs caused by systemic issues such as poverty, racism, family trauma, community violence, and limited access to resources and services. City of Evanston funds will support YOU's capacity to fully staff our clinical positions to provide services to our community's most marginalized populations. We anticipate reaching 575 Evanston residents through our safety net services, all at absolutely no cost to youth and their families. YOU's unique holistic approach, which is grounded in building trusting relationships with youth and families, lowers access barriers in connecting participants to our services. By providing multiple highly accessible avenues of approach, YOU ensures increased resources for those who need them most. In addition to extensive external referrals, we reach our clients through our daily out of school time program that meets free of charge at 8 Evanston Title I schools, our 24/7 youth housing crisis hotline, community programming at YOU's headquarters in the 5th Ward, and our street outreach program that provides street-based outreach and is a vital source of connection to community events. As we build relationships with youth and families across multiple access points, YOU staff identify each client's specific hardship or emerging need and rapidly provide services at no cost to participants. Through YOU's close collaboration with Evanston Public Library or public schools and community partners, as well as the library, our staff receive external referrals from school social workers. McKinney-Vento liaisons, partner organizations, Evanston Land 40, and the Evanston Police Department. YOU's clinical staff are integrated in our daily out-of-school programs. Through their ongoing presence in our out-of-school programs, our youth and family counselors are able to monitor the well-being of youth and families and identify those who benefit from deeper services, such as individual, group, and family counseling or case management provided by YOU's clinical team. Similarly, YOU's community case manager builds relationships with youth and young adults across community settings. Our community case manager provides safety net items such as hygiene kits and resource cards that serve as an entry point for engaging in individualized case management plans towards achieving stability through housing, employment, or education. Participants identified as needing counseling services for their well-being are referred internally to a YOU youth and family counselor. YOU safety net services are designed to address the immediate needs of Evanston youth and families who are navigating a crisis, cascading hardship in the household, or newly identified needs. Services are provided free of charge, as I mentioned, for the goal of stabilizing each unique situation. Our safety net services may serve as an accessible entry point for engaging youth and families in deeper services, including the comprehensive case management and counseling with our YOU team. Our program model lowers access barriers for low threshold, low barriers for marginalized populations. And for example, immigrant and refugees families who may be particularly marginalized because of language and cultural barriers that present obstacles in connecting to support services and benefits. We reduce language barriers by translating our materials and employing Spanish-speaking staff. YOU provides rapid access to concrete supports to accessible, familiar locations, including our schools, as I mentioned before. Our range of safety net services include food through, for example, gift cards for grocery stores or breakfast items for youth identified as being food insecure in our summer program. Transportation, we provide gas cards as well as venture cards, clothing, including diapers, tangible items to support families facing hardships during holidays, connections to shelters and stable housing, street outreach, and drop-in services, including hygiene items and access to showers that meet the immediate needs of runaway, homeless, and housing insecure youth. Again, we just want to thank you for considering our request and for your longtime support.
Thank you so much, Teresa. That was very helpful. Committee questions? I'll just say again, thank you for all you do. Thank you for sticking with us this late hour. I am too not a night person, but I so appreciate your commitment, not only this evening, but all the time. So thank you.
Absolutely.
And our last, but definitely not least, our presentation, we have YWCA.
The YWCA is was funded in last year and the year before, and is asking for the same amount of funding for their
You're doing great, Jessica.
Thanks, Hillary.
Here you go, Hillary. Hopefully you're here with us.
Can you hear me?
We sure can, Hillary.
Oh my gosh.
Welcome.
The caboose. Okay. Thank you. Good evening, good night.
Yes.
It's really lovely to be here with all of you. My name is Hillary Doohan. I'm the director of the Domestic Violence Department at the YWCA Evanston North Shore. And my pronouns are she, her. We're located at 1215 Church Street in Evanston, 847-864-8445, ywca-ens.org. We've been located in Evanston since 1931 and providing comprehensive wraparound domestic violence services for almost 40 years. and we serve survivors and their families, not just in Evanston, but all over northeastern Cook County. And this past year, we had served about 300 unduplicated Evanston residents, mostly primarily very low to low income, a lot of homeless folks, mostly female-headed households. We provide services that are both bilingual and bicultural. All of our services are voluntary, free, and use a trauma-informed, equity-focused lens. We have counseling in English and Spanish for adults, for children, and for families. We also have legal advocacy services, comprehensive case management, and our array of residential services, which includes emergency shelter, long-term supportive housing, and transitional housing services as well. Recently, in the last 2 years, developed an immigrant empowerment program that has been working with Spanish-speaking survivors, doing training to become community advocates so that we can equip folks with the knowledge and resources to go into their own communities and provide support and connection to our services, because we know that traditionally a lot of immigrant folks are mistrustful of institutions, and we want to encourage folks to be able to get the support they need without having to directly come to us first. We also provide a lot of direct financial assistance to assist survivors in their healing journey. There's a lot of economic barriers that keep survivors in abusive situations. And so that could be transportation cards, food, clothing, and hygiene products assistance. We also provide rental assistance and utility assistance, whether that's someone starting to get an apartment or just who's fallen a little bit behind. We also partner with our Leadership and Economic Advancements Department to provide workforce development programming, employment services for our survivors as well. In an emergency shelter, actually, we have a really great sort of partnership with our culinary program, where folks who are learning food service skills get to prepare food for our shelter residents, and then earn internship credit towards their sanitation food handling license. The conduit into all of our services is our 24-hour crisis line. And we have interpreters on hand so that we can speak with folks in any language. I'm sorry, I know I'm a little bit rambly because it's
I know it's great. I didn't even realize I was unmuted. I was like, oh, that's great. So sorry.
We really appreciate partnering with the city in many different ways over the years, and this funding is used for personnel costs. And actually, we're really excited because there's 12 domestic violence programs in my department, and we're adding an assistant DV director position to really expand our capacity, our operational and administrative capacity to support staff and expand programming. I would say that one of the things we're proud of as well about our programming is that we have an impact and data strategy director. And we've also moved to a cloud-based case management system. And so that really helps our ability to do care coordination, to collect data, and to really measure our impact across the agency in a more comprehensive and meaningful way.
No, Hillary, that was great. An amazing job. You
Absolutely.
And the work you're doing, the purposefulness and intentionality that you're putting into such critical work, it shows, and your commitment is evident. And so thank you. Thank you for what you do for those that you serve. Thank you for what you do for our community. And oh my goodness, thank you for staying with us so late. And from the committee. Okay. We have more items, but I just want to thank all of you who've stuck with us. We will promise to try to have shorter meetings in the future. And with that, I believe we move to item 5C, which is staff reports.
Yep, and thank you so much. I will keep this very quick. Although I am going to share my screen and share a slide. And the reason that I'm sharing is because the committee has a big decision to discuss, and that is how we're going to analyze these applications. And again, they were all so strong. Thanks again to everyone for the presentations. I just want to echo what the chair has said. But traditionally, the committee has, can everyone see my screen?
Yes.
Yeah.
Perfect.
Yes.
Okay, great. So the committee has sort of 3 options. There is a score tool in Zoom Grants. And for those who have not accessed it before, I would be happy to schedule a time to run through the scoring tool. There is also a way to provide allocation recommendations or your own personal amount. And then prior to the meeting, I compile all the scores. I take an average of all of the award amounts, and that becomes sort of the basis for the allocation recommendations that the committee will make in January. In prior years, the social services or the committee is also able to identify a working group of 2 volunteers who might want to review the scores and review the average allocations and provide a recommendation that the committee can use to initiate the discussion. Or the committee can just have separate spreadsheets where committee members provide award amounts, and then they are sent to me so that we're not violating Open Meetings Act, and then staff works to come up with the averages and present those at our next meeting. The reason that I'm bringing this up is because we've got a pretty tight turnaround here, and given the holidays, we're not quite sure. I'm not quite sure what everybody can commit to. So hopefully, let me say, our original next meeting is Thursday, January 12th. And on the left-hand side of the screen, you can see members have the ability, after hearing these wonderful presentations and after reviewing the applications, to provide any additional questions to agencies. Should members want to do that, I have a deadline of Wednesday, December 14th. So you would submit questions for agencies or questions about applications to me. I then go into Zoom Grants and post those questions to the agencies, and then they have the opportunity to respond. If we're going with the January 12th next meeting, agencies would provide responses Wednesday, the 21st, or at the latest Thursday, the 22nd, so I can let committee members know that their questions have been answered. And then committee members, I'm going to ask you to get in your scores and your award amounts by Wednesday, January 4th. So I know everyone's got big holiday plans or the holidays are upon us, but Wednesday, January 4th would be my deadline for compiling that information for the packet deadline for the January 12th meeting. Now, if we can, oh, go ahead, Cheryl Fry.
I think I'm going to, can I make a very strong recommendation that we potentially
Push
move
it.
the meeting to the 19th?
Yeah.
Okay,
We-
great.
Well, I'm sorry, wait, we can, but the only thing that I wanted to put out is that there is the Equity and Empowerment committee meeting on Thursday, January 19th. And I believe, forgive me, I'm sorry, I can't remember if it's Councilmember Reed or Councilmember Burns who's a part of that
Councilmember
committee.
Reed.
Okay. So that would be my hope and suggestion to push the meeting, but I just wanted to bring it up in case there are.
I think the other reason why I was interested in following your lead, Chairman, was the fact that this would give time for the other members of the committee to
Yeah.
review the applications and submit their questions in a timely manner. I understand that it will push people up against the holiday if we do it on the 12th, but it may take a little longer, but so that we are clear about why we're voting, how we're voting, might eliminate some, not eliminate, but clarify, clear. Oh, I can't even talk now. Okay. It might make it clearer that how our process is going and how we come about this Rubik's result.
Agreed. Councilmember Reed,
Okay,
and it
yeah,
impacts you the most, I guess.
right. Is you there?
Would it be appropriate to have a strong recommendation via email to all members of the committee, including those who weren't able to make it tonight, and ask if they could make it on the 19th? I mean, we do have a number of people who were not at tonight's meeting, but I think that it's important to try to get as many committee members as possible, obviously.
Yeah.
And I know it's really hard to decide or do this at this hour with so many committee members not here.
Yeah.
Mhm.
Why don't we go with that? See if there's availability. But that at least there was an indication of leaning in that direction to give everybody time and to give agencies time. I mean, it's not just us, but it's everybody.
Great.
It's a tough time of year to get things done on what might be normal timeframes because of the two holidays, so. Or three, depending, even four, depending on which one's one.
Right.
So could the email actually just outline one approach, right? One set of steps we want to take, right? Rather than offer a bunch of options.
Yes, I think we'll just propose moving it till to the 19th and ask people to confirm that they would be able to make that meeting. How does that sound?
Sure.
I'm sorry, I would
what
also need committee members to decide about the Zoom grant score tool or allocation suggestions or a working group. Like maybe with the working group, we can.
I think the
take that
working group
right off the
probably
table.
isn't practical.
Yeah, that's
I
fine.
suggest we just direct people to the Zoom grants. It's actually quite functional, and I think people will find it quite helpful. And then obviously we can provide technical assistance to,
I'll be calling for technical assistance.
That's fine. I'm here for everybody. I'm here for everybody. And the only reason I say that is because then I can put in the poll about changing the meeting or the email that I send information about when people need to either get their questions for agencies or get their scores into staff. So
I would agree. Yeah, I
All
think that's the good, and you're going to then give us a deadline, though, that will be before the 19th, right?
Yes,
Oh, yes.
Okay.
Absolutely.
Okay, that's great.
And you'll send out the Zoom grants link again and all of that. And I am not technically savvy, but I did find it quite functional. So.
Well, then we'll call you for technical assistance.
Oh, I called Jessica.
So I have one question. Is there like a budget limit that we're dealing with? Okay.
Yes.
I think that would be good if you'd let us know.
Yeah.
Can I have a whole other presentation on that? But you and I can talk, and I'll bring you up to speed. But yes.
And
Okay.
you had a nice, simple spreadsheet where it was just, here's the committee allocation, here's what we agreed to for case management, safety net, like, and it was real simple. Can you send that out again of like where we are this year? What's our number for 23? I think that is helpful. The scoring is like one thing, but I think when you get to the recommending of the allocation, I found that helpful.
Yes, yes. And just for the people who are still our attendees hanging on, thank you all so much. This information will be included in the packet for January. So it will be available for public review. The sort of amounts we have, our award amounts, how we're making these decisions, and then what the committee has done in the past in terms of allocating for case management, safety net, and support services. So there should be no surprises.
And the one last thing is the federal government has not done its appropriations bills for
Right.
this fiscal year. So our CDBG amount is estimated conservatively, we hope. We hope that we will get that or maybe a little more money. So, there are always some fluctuations that I wish we could control, but if anybody can control Congress, I would love to know who it is.
More information about that will also be in the memo.
Yes.
And can you remind us before we adjourn? So as we're starting to think about this, the funding, the resources we have for this year compared to for 23 compared to this year, same increase?
It is very, very close, because even though the amount we're estimating with under the amount of actual CDBG money we got this year in our entitlement grant, we got more program income, which raises, because it's 15% of the CDBG entitlement grant and the program income. And we have about $147,000 worth of NSP2 grant money that was program income that is being transferred to our CDBG program that gives us that extra bump. Yay, how's that for fortuitous?
All right. Thank you. Thank you, Ken, for sticking with us for first meeting, and for Kathy, and all right, we will see you guys next month.
Wait, okay,
Right.
so I'm sorry. Do we have to, I'm sorry, Devon, go ahead.
No, I was just gonna say thank you. Go ahead.
So do we have to, I'm sorry, my brain's kind of off. Do we have to make a motion for that suggestion of January 19th?
I don't think so, because it's via email, right? I mean, we're not deciding.
Right, we haven't decided. That date is in the list of draft meeting dates. And it is flagged. I'll send around the doodle poll to confirm that we've got quorum.
I don't think we have to. I think as a technicality, yes, formally should
Because
approve
there were
our
two
either
dates,
regular
right?
meeting dates or our meeting dates. But whatever works.
I guess you could vote to approve the proposed schedule, including the 19th, subject to confirmation of it working for committee members not available. Would that make it easier? I'm just trying to figure out anything that can make it not come.
I'll move that.
Great.
Thank you.
Thank you, Councilmember Reed. Kathy, do I hear a second?
You sure did.
All right, Jessica.
Yep, Charles Fry.
Aye.
Yep, Councilmember Reed.
Aye.
Councilmember Burns.
Aye.
Kathy Hayes.
Aye.
Thank you, and Ken Rowling.
Aye.
Great.
And with that,
Thank you.
guys.
And
Happy
good news,
holidays.
when I went darkened my screen, I was working on updating the memo to City Council with the new recommendations. So that's all ready to go now.
Ah, okay, thank you. Wow.
I didn't just disappear on you. I was listening, but I was working and I thought it was rude to.
Wow, you guys are Cracker Jacks. Yeah.
All right.
And not to add another 2 minutes, but we might, but are we gonna add another public comment? Somebody just texted me.
Oh, yeah.
Thank you, Councilmember
Thank you
Burns.
for
We love
reminding
public
us.
comment in this committee. So do we have anybody who would like to make additional public comments at the hour of 11:35?
Thank you so much.
Okay. Ally?
Yes.
let us know.
Hey.
Hello, Ally.
Good evening, everyone. Oh my gosh, thank you for this incredibly long meeting. I really admire your fortitude. But thank you so much. I just wanted to put a little plug in for something that was talked about earlier, the LAN, the Local Area Network of Social Service Agencies. It is a network of social service agencies, and I manage the email list. So if anybody would be interested in joining it, you can email me at harneda@district65.net. We have monthly meetings on the second Tuesday of the month at 10 a.m. on Zoom. And it's a really great way to learn about things that are going on with many of the great agencies that spoke tonight, and other agencies as well. So if anybody would like to join, we'd love to have you. Next Tuesday, oh my gosh, what day will that be? The 13th is our next meeting. So it would be a great time to hop in and join the LAN.
Perfect. Thank you so much, Ally, for sharing that. And Jessica will pull that into the minutes, right?
Yes.
Perfect. Thank you so much, Ally.
And I'll make a
Thank you,
quick public
everyone.
comment as well, but I just want to say the reason the meeting, and this is for the people who watch this later, and if anybody's still on at this hour, but the reason this meeting was long is because there was an issue that required additional thoughtful discussion that was referred back to this committee. But otherwise, that particular issue was at council, would have stayed at council for a final vote, and we only would have been discussing, I think, the last, 2 items on the agenda as opposed to 3. So I just wanted to, I don't want to scare Ken off on his first day. And then I want our agencies to come back and seek support. So, and that is all, Chair. Thank you.
Well, thank you so much.
Absolutely.
Thank you, Councilmember Burns. And yes, I think you will find we will have thoughtful discussion, and we do try to be a little more timely, though still robust.
Good. Love
And
it.
with that, I believe we can adjourn.
Good night.
So motion to adjourn.
Motion to adjourn. Thank you, guys.
Thanks,
See you
everyone.
in the new year.
Soon.
Yeah.
Thank you all.
So long.
That's okay. I'll still be calling you for technical assistance.
Kathy, I'm here for you. I'm here for you.
Thank you.
Have a good night.
You too, dear.